NCLEX-RN Practice Questions Test Bank. Question 1. The doctor is assessing a client with suspected meningitis for meningeal irritation. A positive Kernig's sign is charted if the nurse notes: Option A, pain on flexion of the hip and knee. Option B, neutral rigidity on flexion of the neck. Option C, pain when the head is turned to the left side. Option D, dizziness when changing positions. The correct answer is option A, pain on flexion of the hip and knee. Kernig's sign is positive when the client feels pain or resistance when the leg is extended while the hip is flexed 90 degrees. Question 2. A client with Alzheimer's disease uses her toothbrush to brush her hair. The nurse identifies this behavior as: Option A, agnosia. Option B, apraxia. Option C, anomia. Option D, aphasia. The correct answer is option A, agnosia. Agnosia is the failure to recognize or identify objects despite intact sensory function. Using a toothbrush as a hairbrush signifies the client does not recognize the object's purpose. Question 3. A client with dementia experiences increased confusion late in the afternoon and before bedtime. This is known as: Option A, a chronic fatigue syndrome. Option B, normal aging. Option C, sundowning. Option D, delusions. The correct answer is option C, sundowning. Sundowning refers to a state of confusion occurring in the late afternoon and spanning into the night, common in patients with dementia. Question 4. A confused client says, "I haven't had breakfast, despite eating 30 minutes ago." Which response is best? Option A, you know you had breakfast 30 minutes ago. Option B, I am so sorry that they didn't get you breakfast. Option C, I'll get you some juice and toast. Would you like something else? Option D, you will have to wait a while, lunch will be here soon. The correct answer is option C, I'll get you some juice and toast. Would you like something else? In dementia care, validation and distraction are better than arguing. Providing a small snack satisfies the immediate request without causing conflict. Question 5. Which side effect is most often associated with the Alzheimer's drug Exelon, rivastigmine? Option A, urinary incontinence. Option B, a headaches. Option C, a confusion. Option D, nausea. The correct answer is option D, nausea. Exelon is a cholinesterase inhibitor. Gastrointestinal side effects, especially nausea and vomiting, are very common. Question 6. A client in active labor has a papular lesion on the perineum. Which initial action is most appropriate? Option A, document the finding. Option B, report the finding to the doctor. Option C, prepare the client for a C-section. Option D, continue primary care as prescribed. The correct answer is option B, report the finding to the doctor. Papular or vesicular lesions suggest an active herpes infection. This must be reported immediately as it usually necessitates a C-section to protect the infant from neonatal herpes. Question 7. A client with a diagnosis of HPV is at an increased risk for which of the following? Option A, Hodgkin's lymphoma. Option B, cervical cancer. Option C, multiple myeloma. Option D, ovarian cancer. The correct answer is option B, cervical cancer. Human papillomavirus, HPV, is a primary risk factor for the development of cervical dysplasia and cervical cancer. Question 8. A client reports a small blister on the vulva that is painful to touch. The nurse is aware that the most likely source of the lesion is: Option A, syphilis. Option B, herpes. Option C, gonorrhea. Option D, condylomata. The correct answer is option B, herpes. Painful, fluid-filled blisters, vesicles, on the genitalia are the hallmark sign of a herpes simplex virus, HSV, infection. Syphilis, chancres, is typically painless. Question 9. A client is suspected of having NCLEX. The best confirmatory diagnostic test for treponema pallidum, syphilis, is: Option A, a venereal disease research lab, VDRL. Option B, rapid plasma reagent, RPR. Option C, fluorescent treponemal antibody, FTA. Option D, Thayer-Martin culture, TMC. The correct answer is option C, fluorescent treponemal antibody, FTA. VDRL and RPR are screening tests. The FTA-ABS, fluorescent treponemal antibody absorption, test is the definitive confirmatory test for syphilis. Question 10. Which laboratory finding is associated with HELLP syndrome in a pregnant client? Option A, elevated blood glucose. Option B, elevated platelet count. Option C, elevated creatinine clearance. Option D, elevated hepatic enzymes. The correct answer is option D, elevated hepatic enzymes. HELLP stands for hemolysis, elevated liver enzymes, and low platelets. Elevated AST and ALT levels are key diagnostic markers. Question 11. Which method is used to elicit the biceps reflex during a physical assessment? Option A, thumb on the antecubital space, tap thumb with reflex hammer. Option B, loosely suspend the arm while tapping the back of the elbow. Option C is strike the area below the patella while legs dangle. Option D is strike the muscle insert just above the wrist. The correct answer is option A, thumb on the antecubital space, tap thumb with reflex hammer. To elicit the biceps reflex, the nurse places their thumb over the biceps tendon in the antecubital fossa and strikes the thumb. Question 12. A prima gravida with diabetes is at 34 weeks gestation. Which doctor's order should the nurse question? Option A, magnesium sulfate 4gm4. Option B, abretine, terbutaline, 10 mg/g4. Option C, Stadol 1 mg 4 push. Option D, Ensef 2gm IVPB. The correct answer is option B, abretine, terbutaline, 10 mg/g4. Abretine, terbutaline, is a beta-mimetic used to stop preterm labor, but it can cause significant hyperglycemia, making it dangerous for a diabetic client. Question 13. An amniocentesis at 32 weeks shows an L/S ratio of 1:1 in the presence of phosphatidylglycerol. How should the nurse assess this? Option A, the infant is at low risk for anomalies. Option B, the infant is at high risk for growth retardation. Option C, the infant is at high risk for respiratory distress syndrome. Option D, the infant is at high risk for birth trauma. The correct answer is option C, infant is at high risk for respiratory distress syndrome. An L/S ratio of 2:1 is needed for lung maturity. A ratio of 1:1 indicates immature lungs and a high risk for respiratory distress syndrome, RDS. Question 14. Which observation in the newborn of a diabetic mother requires immediate intervention? Option A, crying. Option B, wakefulness. Option C, jitteriness. Option D, yawning. The correct answer is option C, jitteriness. Jitteriness is a primary sign of hypoglycemia in a neonate, which is a common and dangerous complication for infants of diabetic mothers whose blood sugar drops after birth. Question 15. What is an expected, non-toxic, side effect of intravenous magnesium sulfate therapy? Option A, decreased urinary output. Option B, hypersomnolence. Option C, absence of knee-jerk reflex. Option D, decreased respiratory rate. The correct answer is option B, hypersomnolence. Hypersomnolence, drowsiness, or feeling warm is an expected effect. Decreased urine output, absent reflexes, and respiratory depression are signs of magnesium toxicity. Question 16. If a client receives epidural anesthesia and experiences hypotension, what is the nurse's priority action? Option A, place her in Trendelenburg position. Option B, decrease the rate of 4 infusion. Option C, administer oxygen per nasal cannula. Option D, increase the rate of the 4 infusion. The correct answer is option D, increase the rate of the 4 infusion. Epidural anesthesia causes vasodilation. Increasing the 4 fluid rate, bolus, helps restore blood pressure and maintain placental perfusion. Trendelenburg should be avoided as it can cause the block to move higher. Question 17. Which nursing diagnosis is the highest priority for a client with cancer of the pancreas? Option A, alteration in nutrition. Option B, alteration in bowel elimination. Option C, alteration in skin integrity. Option D, ineffective individual coping. The correct answer is option A, alteration in nutrition. Pancreatic cancer causes profound malabsorption and anorexia, making alteration in nutrition, less than body requirements, a critical physiological priority. Question 18. What is the best method for the nurse to use to determine early ascites in a client? Option A, inspection of the abdomen for enlargement. Option B, bimanual palpation for hepatomegaly. Option C, daily measurement of abdominal girth. Option D, the assessment for a fluid wave. The correct answer is option C, daily measurement of abdominal girth. Daily measurement of abdominal girth at the same location, usually the umbilicus, is the most objective and sensitive way to detect early fluid accumulation and monitor progress. Question 19. An MVA victim has a BP of 80/34 and a pulse of 120. What is the most appropriate priority nursing diagnosis? Option A, alteration in cerebral tissue perfusion. Option B, fluid volume deficit. Option C, ineffective airway clearance. Option D, alteration in sensory perception. The correct answer is option B, fluid volume deficit. The low blood pressure and high heart rate, tachycardia, are classic signs of hypovolemic shock, making fluid volume deficit the priority. Question 20. The nurse is visiting an 18-year-old with osteogenesis imperfecta. Which information causes the most concern? Option A. The client likes to play football. Option B. The client drinks several carbonated drinks per day. Option C. The client has sisters with sickle cell trait. Option D. The client is taking acetaminophen for pain. The correct answer is option A. The client likes to play football. Osteogenesis imperfecta causes extremely brittle bones. Participation in contact sports like football is highly dangerous due to the risk of multiple fractures. Question 21. A client on a transplant unit has a decreased WBC count. What action should the nurse take when a visitor brings a basket of fruit? Option A. Allow the client to keep the fruit. Option B. Place the fruit next to the bed. Option C. Offer to wash the fruit for the client. Option D. Tell the family members to take the fruit home. The correct answer is option D. Tell the family members to take the fruit home. Patients with neutropenia are on a low microbial diet. Fresh fruits, vegetables, and flowers are prohibited because they can harbor fungi and bacteria. Question 22. A post-laryngectomy client becomes unresponsive and pale with a BP of 90/40. What is the nurse's initial action? Option A. Place the client in Trendelenburg position. Option B. Increase the infusion of dextrose in normal saline. Option C. Administer atropine intravenously. Option D. Move the emergency cart to the bedside. The correct answer is option B. Increase the infusion of dextrose in normal saline. The patient is showing signs of shock. The immediate priority is to increase the 4 infusion rate to restore circulating volume and stabilize blood pressure. Question 23. A client accidentally pulls out their chest tube. Which action by the nurse is correct? Option A. Order a chest X-ray. Option B. Reinsert the tube. Option C. Cover the insertion site with a Vaseline gauze. Option D. Call the doctor. The correct answer is option C. Cover the insertion site with a Vaseline gauze. If a chest tube is removed, the site must be immediately covered with an occlusive dressing, Vaseline gauze, taped on 3 sides to prevent air from entering the pleural space, pneumothorax. Question 24. A client on warfarin, Coumadin, has a pro-time, patient, of 120 seconds. What is the most important intervention? Option A. Assess for signs of abnormal bleeding. Option B. Anticipate an increase in dosage. Option C. Instruct the client regarding therapy. Option D. Increase frequency of neuroassessments. The correct answer is option A. Assess for signs of abnormal bleeding. A patient of 120 seconds is dangerously high, normal is approximate 11 to 13. The patient is at extreme risk for hemorrhage and must be assessed for bleeding immediately. Question 25. Which food selection provides the most calcium for a client who is 4 months pregnant? Option A. A granola bar. Option B. A bran muffin. Option C. A cup of yogurt. Option D. A glass of fruit juice. The correct answer is option C. A cup of yogurt. Yogurt is an excellent source of calcium, providing significantly more, approximate 300 to 400 milligrams, than the other options listed. Question 26. Which action indicates the nurse understands the potential side effects of magnesium sulfate? Option A. The nurse avoids BP checks in the right arm. Option B. The nurse places a padded tongue blade at the bedside. Option C. The nurse inserts a Foley catheter. Option D. The nurse darkens the room. The correct answer is option C. The nurse inserts a Foley catheter. Magnesium is excreted by the kidneys. A Foley catheter is essential to ensure urine output is adequate, 30 ml/hr. If output drops, magnesium can build to toxic levels. Question 27. A mother refuses a life-saving blood transfusion for her 6-year-old child. What is the most appropriate nursing action? Option A. Ask the mother to leave during the transfusion. Option B. Encourage the mother to reconsider. Option C. Explain the consequences of no treatment. Option D. Notify the physician of the mother's refusal. The correct answer is option D. Notify the physician of the mother's refusal. When a parent refuses life-saving treatment for a minor, the physician and hospital administration must be notified to obtain a court order to treat the child. Question 28. A client was in an explosion and has burns to the face. The nurse should be most concerned about which complication? Option A, hypovolemia. Option B, laryngeal edema. Option C, hypernatremia. Option D, hyperkalemia. The correct answer is option B, laryngeal edema. Facial burns and smoke inhalation carry a high risk of airway obstruction due to laryngeal edema. Maintaining a patent airway is the absolute priority. ABCs. Question 29. Which data indicates that the plan of care for a client with anorexia nervosa is effective? Option A. The client selects a balanced diet from the menu. Option B. The client's hemoglobin improves. Option C. The client's tissue turgor improves. Option D. The client gains weight. The correct answer is option D. The client gains weight. The primary physical goal in treating anorexia nervosa is restoration of nutritional status, which is most objectively measured by steady, controlled weight gain. Question 30. Following repair of a fractured tibia and cast application, which assessment should be reported to the doctor? Option A, pain beneath the cast. Option B, warm toes. Option C, pedal pulses weak and rapid. Option D, itching under the cast. The correct answer is option C, pedal pulses weak and rapid. Weak and rapid pedal pulses, especially when combined with pain, may indicate compartment syndrome or vascular compromise, which is a surgical emergency. Question 31. The client with varicella will most likely have an order for which category of medication? Option A, antibiotics. Option B, antipyretics. Option C, antivirals. Option D, anticoagulants. The correct answer is option C, antivirals. Antiviral medications, such as acyclovir, are used to treat varicella, chickenpox, by inhibiting viral replication, especially in high-risk or immunocompromised patients. Question 32. A client is admitted complaining of chest pain. Which of the following drug orders should the nurse question? Option A, nitroglycerin. Option B, ampicillin. Option C, propranolol. Option D, verapamil. The correct answer is option B, ampicillin. Ampicillin is an antibiotic. It is not indicated for the treatment of chest pain or cardiac conditions, making it an inappropriate order in an acute cardiac workup. Question 33. Which of the following instructions should be included in the teaching for the client with rheumatoid arthritis? Option A. Avoid exercise because it fatigues the joints. Option B. Take prescribed anti-inflammatory medications with meals. Option C. Alternate hot and cold packs to affected joints. Option D. Avoid weight-bearing activity. The correct answer is option B. Take prescribed anti-inflammatory medications with meals. NSAIDs and other anti-inflammatory drugs commonly cause gastrointestinal irritation. Taking them with food or milk helps protect the stomach lining. Question 34. A client with acute pancreatitis is experiencing severe abdominal pain. Which of the following orders should be questioned by the nurse? Option A, meperidine 100 mg IM Q4 hours PRN. Option B, Mylanta 30 ccs Q4 hours Viaducting. Option C, cimetidine 300 mg per QID. Option D, morphine 8 mg IM Q4 hours PRN. The correct answer is option C, cimetidine 300 mg per QID. Patients with acute pancreatitis are typically kept NPO, nothing by mouth, to rest the pancreas and prevent the release of digestive enzymes. Any oral, PUP, medication order should be questioned. Question 35. The nurse is aware that the doctor has ordered continuous observation for a client in the chemical dependence unit because Option A, hallucinogens create both stimulant and depressant effects. Option B, hallucinogens induce a state of altered perception. Option C, hallucinogens produce severe respiratory depression. Option D, hallucinogens induce rapid physical dependence. The correct answer is option B, hallucinogens induce a state of altered perception. Hallucinogenic drugs, like LSD or PCP, cause distorted perceptions and potential psychosis, necessitating continuous observation for the safety of the patient and others. Question 36. A patient arrives at the emergency department complaining of mid-sternal chest pain. Which nursing action should take priority? Option A, a complete history with emphasis on preceding events. Option B, an electrocardiogram. Option C, careful assessment of vital signs. Option D, chest exam with auscultation. The correct answer is option C, careful assessment of vital signs. Assessment of vital signs is the priority to determine the patient's immediate hemodynamic stability and provide a baseline for emergency care before moving to diagnostics like an EKG. Question 37. Which misunderstanding by the family regarding pneumonia discharge indicates the need for more detailed information? Option A. The patient may resume normal activities as tolerated. Option B. The patient should resume a normal diet. Option C. The patient may discontinue oral antibiotics once symptoms resolve. Option D. The patient should continue use of the incentive spirometer. The correct answer is option C. The patient may discontinue oral antibiotics once symptoms resolve. Patients must complete the entire course of prescribed antibiotics even if they feel better to ensure the infection is fully eradicated and to prevent antibiotic resistance. Question 38. A nurse is caring for an elderly Vietnamese patient in the terminal stages of lung cancer. Which action should the nurse take regarding the family's rituals? Option A. Restrict visiting hours to 2 at a time. Option B. Notify visitors that only clear fluids are allowed. Option C. Keep the other bed in the room unassigned to provide privacy. Option D. Contact the physician to report the unusual rituals. The correct answer is option C. Keep the other bed in the room unassigned to provide privacy. Providing the family with privacy allows them to practice cultural rituals and provide support during the end-of-life process, which is a hallmark of culturally competent care. Question 39. The charge nurse is planning assignments. Which is the most appropriate assignment for the float nurse from labor and delivery? Option A. A 1-week postoperative coronary bypass patient. Option B. A suspected myocardial infarction patient on telemetry. Option C. A patient with unstable angina. Option D. A postoperative valve replacement patient in a non-surgical bed. The correct answer is option A. A 1-week postoperative coronary bypass patient. A float nurse should be assigned the most stable and predictable patient. A 1-week post-op patient is generally stable, whereas the others require specialized cardiac monitoring. Question 40. An 8-year-old child's physician has prescribed glucagon for emergency use. What is the purpose of this medication? Option A. Glucagon enhances the effect of insulin. Option B. Glucagon treats hypoglycemia resulting from insulin overdose. Option C. Glucagon treats lipoatrophy from insulin injections. Option D. Glucagon prolongs the effect of insulin. The correct answer is option B. Glucagon treats hypoglycemia resulting from insulin overdose. Glucagon is a hormone that causes the liver to release stored glucose into the bloodstream. It is the standard emergency treatment for severe hypoglycemia. Question 41. An infant with congestive heart failure is receiving diuretic therapy. Which symptom would indicate the dosage may need to be increased? Option A. Sudden weight gain. Option B. Decreased blood pressure. Option C. Slow, shallow breathing. Option D. Bradycardia. The correct answer is option A. Sudden weight gain. In CHF, sudden weight gain indicates fluid retention and worsening heart failure, suggesting that the diuretic dose is insufficient to clear excess fluid. Question 42. A patient taking phenytoin, Dilantin, is experiencing breakthrough seizures. Which serum drug level indicates a subtherapeutic level? Option A. 15 mcg/ml. Option B. 4 mcg/ml. Option C. 10 mcg/ml. Option D. 25 mcg/ml. The correct answer is option B. 4 mcg/ml. The therapeutic range for phenytoin is 10 to 20 mcg/ml. A level of 4 mcg/ml is too low, subtherapeutic, to effectively prevent seizure activity. Question 43. A patient reports taking 3 acetaminophen tablets every 3 hours for a week. Which symptom suggests toxicity? Option A. Tinnitus. Option B. Diarrhea. Option C. Hypertension. Option D. Hepatic damage. The correct answer is option D. Hepatic damage. Acetaminophen is metabolized by the liver. Excessive chronic intake leads to hepatotoxicity, which can result in jaundice, elevated liver enzymes, and liver failure. Question 44. A nurse is caring for a cancer patient receiving subcutaneous morphine sulfate for pain. Which nursing action is most important? Option A. Monitor urine output. Option B. Monitor respiratory rate. Option C. Monitor heart rate. Option D. Monitor temperature. The correct answer is option B. Monitor respiratory rate. Opioids like morphine can cause life-threatening respiratory depression. Monitoring the respiratory rate is the highest priority for patient safety. ABCs. Question 45. A patient has severe lower leg pain after a fall in a football game. Which is the appropriate next step in assessment? Option A. Apply heat to the painful area. Option B. Apply an elastic bandage to the leg. Option C. X-ray the leg. Option D. Give pain medication. The correct answer is option C. X-ray the leg. If a fracture is suspected, an X-ray is required to confirm the diagnosis before applying bandages or heat, which could cause further injury or mask symptoms. Question 46. Which patient is most likely to have an automatic internal cardioverter defibrillator, AICD, implanted? Option A. A patient with ME without cardiac muscle damage. Option B. A postoperative coronary bypass patient. Option C. A patient with a history of ventricular tachycardia and syncope. Option D. A patient with a history of atrial tachycardia and fatigue. The correct answer is option C. A patient with a history of ventricular tachycardia and syncope. AICDs are indicated for patients at high risk of sudden cardiac death due to lethal ventricular arrhythmias like VTach or VFib. Question 47. A patient is scheduled for an MRI scan for suspected lung cancer. Which of the following is a contraindication? Option A. The patient is allergic to shellfish. Option B. The patient has a pacemaker. Option C. The patient suffers from claustrophobia. Option D. The patient takes antipsychotic medication. The correct answer is option B. The patient has a pacemaker. The strong magnets used in MRI can deactivate or cause a malfunction in a permanent pacemaker, making it a strict contraindication. Question 48. A nurse suspects a patient has developed a pulmonary embolism. Which symptom has the nurse most likely observed? Option A. The patient is somnolent. Option B. The patient suddenly complains of chest pain and shortness of breath. Option C. The patient has developed a wet cough and crackles. Option D. The patient has a fever, chills, and loss of appetite. The correct answer is option B. The patient suddenly complains of chest pain and shortness of breath. The sudden onset of dyspnea, shortness of breath, and pleuritic chest pain are the hallmark signs of a pulmonary embolism. Question 49. Workup reveals the presence of a rapidly enlarging abdominal aortic aneurysm. Which action should the nurse expect? Option A. Admission for observation and medication. Option B. Admission for sclerotherapy. Option C. Admission to surgery for resection. Option D. Discharge home with cardiologist follow-up. The correct answer is option C. Admission to surgery for resection. A rapidly enlarging aneurysm is at high risk for imminent rupture, which is a surgical emergency requiring immediate repair. Question 50. A leukemia patient has a platelet count of 25,000/microliter. Which action should be included in the care plan? Option A. Monitor for fever every 4 hours. Option B. Require visitors to wear respiratory masks. Option C. Consider transfusion of packed red blood cells. Option D. Check for signs of bleeding in urine and stool. The correct answer is option D. Check for signs of bleeding in urine and stool. A platelet count below 50,000, thrombocytopenia, puts the patient at high risk for spontaneous bleeding. Monitoring urine and stool for blood is essential. Question 51. A nurse teaches family members about infectious precautions for a leukemia patient. Which statement indicates the family needs more education? Option A. We will bring in books and magazines for entertainment. Option B. We will bring in personal care items for comfort. Option C. We will bring in fresh flowers to brighten the room. Option D. We will bring in family pictures and get well cards. The correct answer is option C. We will bring in fresh flowers to brighten the room. Fresh flowers and plants are prohibited for neutropenic patients because the soil and water can harbor mold and bacteria, like Pseudomonas, that cause infection. Question 52. A nurse is caring for a patient with acute lymphoblastic leukemia, ALL. Which of the following is the most likely age range of the patient? Option A. 3 to 10 years. Option B. 25 to 35 years. Option C. 45 to 55 years. Option D. Over 60 years. The correct answer is option A. 3 to 10 years. ALL is the most common childhood cancer, with the peak incidence occurring in children between the ages of 3 and 10 years. Question 53. A patient is admitted for diagnosis of suspected Hodgkin's disease. Which symptom is typical of Hodgkin's disease? Option A, painful cervical lymph nodes. Option B, night sweats and fatigue. Option C, nausea and vomiting. Option D, weight gain. The correct answer is option B, night sweats and fatigue. These symptoms, such as drenching night sweats, persistent fever, and fatigue, are common systemic manifestations of Hodgkin's disease. Lymph nodes are typically painless. Question 54. If the diagnosis of Hodgkin's disease were correct, which of the following cells would the pathologist expect to find? Option A, Reed-Sternberg cells. Option B, lymphoblastic cells. Option C, Gaucher's cells. Option D, Reeder's cells. The correct answer is option A, Reed-Sternberg cells. The presence of Reed-Sternberg cells, large, multinucleated alloy cells, in a lymph node biopsy is the definitive diagnostic marker for Hodgkin's disease. Question 55. A patient is about to undergo bone marrow aspiration and expresses fear. Which is the most effective nursing response? Option A, warn the patient to stay very still. Option B, encourage the family to stay in the room. Option C, stay with the patient and focus on slow, deep breathing for relaxation. Option D, delay the procedure. The correct answer is option C, stay with the patient and focus on slow, deep breathing for relaxation. Guided relaxation and a calming presence are effective ways to manage procedural anxiety and help the patient remain still during an invasive procedure. Question 56. A mother is concerned her 2.5-year-old son is not yet toilet trained for urine. Which statement by the nurse is correct? Option A, the child should have been trained by age 2. Option B, bladder control is usually achieved before bowel control. Option C, bowel control is usually achieved before bladder control. Option D, the child should be told no each time he wets. The correct answer is option C, bowel control is usually achieved before bladder control. Developmentally, children typically achieve bowel control before bladder control. Physiologic readiness for toilet training usually occurs between 24 and 36 months. Question 57. A 14-month-old child will not fall asleep without a bottle of milk. Which instruction by the nurse is correct? Option A, allow the child to have the bottle at bedtime. Option B, put juice in the bottle instead of milk. Option C, give only a bottle of water at bedtime. Option D, do not allow bottles in the crib. The correct answer is option D, do not allow bottles in the crib. Bottles in the crib at night are the primary cause of early childhood caries, bottle rot, and increase the risk of choking and ear infections. Question 58. Which of the following actions is not appropriate in the care of a 2-month-old infant? Option A, place the infant on her back for naps. Option B, allow the infant to cry for 5 minutes before responding. Option C, talk to the infant frequently and make eye contact. Option D, wait until at least 4 months to add cereals to the diet. The correct answer is option B, allow the infant to cry for 5 minutes before responding. At 2 months, infants are in the trust versus mistrust stage and lack the ability to self-soothe. They require prompt responsiveness to build security. Question 59. Which of the following suggestions would be helpful to prevent constipation in an older patient? Option A, moderate exercise for 30 minutes each day. Option B, drink 6 to 8 glasses of water each day. Option C, eat a diet high in fiber. Option D, all of the above. The correct answer is option D, all of the above. The combination of physical activity, adequate hydration, and high dietary fiber is the gold standard for preventing and treating constipation non-pharmacologically. Question 60. A child has suspected rheumatic fever. Which of the following observations is not confirming the diagnosis? Option A, a reddened rash over the trunk. Option B, a history of sore throat in the past month. Option C, a negative anti-streptolicin (ASO) titer. Option D, an unexplained fever. The correct answer is option C, a negative anti-streptolicin (ASO) titer. A positive ASO titer is required to confirm a recent streptococcal infection, which is the necessary precursor for a diagnosis of rheumatic fever. Question 61. A nurse notes a moderate amount of serous drainage on a surgical dressing 24 hours after surgery. Which of the following is the appropriate nursing action? Option A, notify the surgeon about infection immediately. Option B, leave the dressing intact. Option C, remove the dressing and leave the wound open to air. Option D, change the dressing and document the clean appearance of the wound. The correct answer is option D, change the dressing and document the clean appearance of the wound. Serous drainage, clear/yellowish, is normal 24 hours post-op. The nurse should change the dressing to maintain hygiene and inspect the site. Question 62. Which patient complaint regarding a new fiberglass cast on the right radius would cause the nurse to be most concerned about impaired perfusion? Option A, severe itching under the cast. Option B, severe pain in the right shoulder. Option C, severe pain in the right lower arm. Option D, increased warmth in the fingers. The correct answer is option C, severe pain in the right lower arm. Unrelieved, severe pain in the affected limb is an early sign of compartment syndrome and impaired tissue perfusion. Question 63. An older patient with osteoarthritis is preparing for discharge. Which of the following information is correct? Option A, daily exercise helps decrease discomfort. Option B, joint pain will diminish after a full night of rest. Option C, NSAIDs should be taken on an empty stomach. Option D, Tylenol is a more effective anti-inflammatory than Motrin. The correct answer is option B, joint pain will diminish after a full night of rest. Osteoarthritis pain is typically characterized by wear and tear. The pain increases with activity and is relieved by rest. Question 64. Which patient should not be prescribed alendronate, Fosamax, for osteoporosis? Option A, a patient treated for high blood pressure with an ACE inhibitor. Option B, a patient who is allergic to iodine/shellfish. Option C, a patient on a calorie-restricted diet. Option D, a patient on bed rest who must maintain a supine position. The correct answer is option D, a patient on bed rest who must maintain a supine position. Fosamax requires the patient to remain upright for at least 30 minutes after ingestion to prevent severe esophageal irritation/erosion. Question 65. Which of the following strategies is not effective for the prevention of Lyme disease? Option A, insect repellent on the skin and clothes. Option B, long-sleeved shirts and long pants. Option C, prophylactic antibiotic therapy prior to anticipated exposure. Option D, careful examination of skin and hair for ticks. The correct answer is option C, prophylactic antibiotic therapy prior to anticipated exposure. Prophylactic antibiotics are not routinely given before an exposure. Prevention focuses on avoiding tick bites and prompt removal. Question 66. Which of the following indicates the need for discontinuation of Enforline? Option A, the patient complains of pain from movement. Option B, the area proximal to the site is reddened, warm, and painful. Option C, the FOR solution is infusing too slowly when the limb is elevated. Option D, a hematoma is visible in the area of the FOR insertion site. The correct answer is option B, the area proximal to the site is reddened, warm, and painful. Redness, warmth, and pain, phlebitis, require the immediate removal of the FOR to prevent further vein irritation or infection. Question 67. A patient sitting up in bed is dyspneic with crackles in both lung bases after receiving 2 units of blood. Which complication is most likely? Option A, febrile non-hemolytic reaction. Option B, allergic transfusion reaction. Option C, acute hemolytic reaction. Option D, fluid overload. The correct answer is option D, fluid overload. Crackles in the lungs and dyspnea are classic signs of transfusion-associated circulatory overload, TACO, or fluid overload. Question 68. A patient in labor has just received an amniotomy. Which of the following is correct regarding this procedure? Select all that apply. Option A, frequent checks for cervical dilation are needed. Option B, contractions may become stronger and closer together. Option C, the FHR will be followed closely due to potential cord compression. Option D, the procedure is followed by a gush of amniotic fluid. The correct answer is option C, the FHR will be followed closely due to potential cord compression. After an amniotomy, AROM, the primary nursing priority is monitoring fetal heart rate to detect cord compression or prolapse. Question 69. Which instruction regarding a newborn with hyperbilirubinemia is not correct? Option A, continue to breastfeed frequently. Option B, follow up with a physician within 72 hours. Option C, watch for signs of dehydration. Option D, keep the baby quiet, swaddled, and in a dimly lit area. The correct answer is option D, keep the baby quiet, swaddled, and in a dimly lit area. Infants with jaundice need exposure to light, natural or phototherapy, to help break down bilirubin. A dimly lit area is counterproductive. Question 70. Which instruction should the nurse provide regarding car safety for a healthy newborn trip home? Option A, restrained in a car seat, in the back seat, rear facing. Option B, restrained in a car seat, in the front passenger seat. Option C, restrained in a car seat facing forward in the back seat. Option D, the parent may sit in the back seat and hold the newborn. The correct answer is option A, restrained in a car seat, in the back seat, rear facing. Safety standards require newborns to be in a rear-facing car seat in the back seat of the vehicle. Question 71. A nurse is administering 4-furosemide to a patient with CHF. After the infusion, which symptom is not expected? Option A, increased urinary output. Option B, decreased edema. Option C, decreased pain. Option D, decreased blood pressure. The correct answer is option C, decreased pain. Furosemide is a diuretic used to reduce fluid volume. It has no direct analgesic properties to decrease pain. Question 72. There are a number of risk factors associated with coronary artery disease. Which of the following is a modifiable risk factor? Option A, obesity. Option B, heredity. Option C, gender. Option D, age. The correct answer is option A, obesity. Obesity is modifiable through diet and exercise, whereas heredity, gender, and age are non-modifiable risk factors. Question 73. Which of the following is a contraindication for treatment with tissue plasminogen activator, TPA? Option A, worsening chest pain that began earlier in the evening. Option B, history of cerebral hemorrhage. Option C, history of prior myocardial infarction. Option D, hypertension. The correct answer is option B, history of cerebral hemorrhage. A history of intracranial bleeding is an absolute contraindication for thrombolytics, TPA, due to the risk of fatal hemorrhage. Question 74. Following myocardial infarction, what is the primary purpose of encouraging frequent leg exercises and ambulation? Option A, increases fitness and prevents future heart attacks. Option B, prevents bed sores. Option C, prevents deep vein thrombosis, DVT. Option D, prevent constipations. The correct answer is option C, prevents deep vein thrombosis, DVT. Ambulation and leg exercises promote venous return and are critical in preventing the formation of deep vein thrombi. Question 75. Which symptom should the nurse expect a patient to exhibit if they are in cardiogenic shock? Option A, hypertension. Option B, bradycardia. Option C, bounding pulse. Option D, a confusion. The correct answer is option D, confusion. Decreased cardiac output in cardiogenic shock leads to poor cerebral perfusion, manifesting as confusion, restlessness, or agitation. Question 76. Which of the following is a hereditary risk factor for developing atherosclerosis? Option A, family history of heart disease. Option B, overweight. Option C, smoking. Option D, age. The correct answer is option A, family history of heart disease. A family history of heart disease is a genetic/hereditary factor that increases an individual's risk for atherosclerosis. Question 77. Which of the following facts about claudication is correct? Select all that apply. Option A, oxygen demand is greater than oxygen supply. Option B, pain often occurs during rest. Option C, it is a result of tissue hypoxia. Option D, it is characterized by cramping and weakness. The correct answer is option A, oxygen demand is greater than oxygen supply. Claudication is ischemia-related pain, cramping/weakness, that occurs when the muscle's oxygen demand exceeds the available supply. Question 78. Which instruction should be included for a patient with peripheral vascular disease, PVD? Option A, walk barefoot whenever possible. Option B, use a heating pad to keep feet warm. Option C, avoid crossing the legs. Option D, use antibacterial ointment to treat skin lesions. The correct answer is option C, avoid crossing the legs. Crossing the legs compresses vessels and can further impair already compromised circulation in a patient with PVD. Question 79. A patient diagnosed with Raynaud's disease, vasospastic disorder, is most likely to fit which description? Option A, an adolescent male. Option B, an elderly woman. Option C, a young woman. Option D, an elderly man. The correct answer is option C, a young woman. Raynaud's disease predominantly affects young women, typically between the ages of 15 and 30. Question 80. A pregnant patient on bed rest for 6 days has sudden shortness of breath and chest pain. What is the most likely cause? Option A, myocardial infarction. Option B, pulmonary embolism due to DVT. Option C, anxiety attacks. Option D, congestive heart failure. The correct answer is option B, pulmonary embolism due to DVT. Pregnancy and prolonged immobility are major risk factors for DVT, which can lead to a life-threatening pulmonary embolism. Question 81. What is a significant and dangerous complication associated with thrombolytic therapy used in stroke treatment? Option A, hair embolism. Option B, a cerebral hemorrhage. Option C, expansion of the clot. Option D, a resolution of the clot. The correct answer is option B, cerebral hemorrhage. The primary risk of thrombolytic therapy is major bleeding, most dangerously a cerebral hemorrhage. Question 82. An infant holds his head in an unusual position and always faces to one side. What is the most likely explanation? Option A, torticollis. Option B, craniosynostosis. Option C, plagiocephaly. Option D, hydrocephalus. The correct answer is option A, torticollis. Torticollis, Rhineck, is caused by the shortening or contraction of the sternocleidomastoid muscle, causing the head to tilt. Question 83. Which statement about Osgood-Schlatter disease is correct? Option A, caused by competitive swimming. Option B, usually requires surgical intervention. Option C, patient experiences pain in the inferior aspect of the knee. Option D, student is trying to avoid physical education. The correct answer is option C, patient experiences pain in the inferior aspect of the knee. Osgood-Schlatter is an overuse injury causing pain and swelling at the tibial tubercle, just below the kneecap. Question 84. A nurse asks a 13-year-old female to bend forward at the waist with arms hanging freely. Which assessment is being conducted? Option A, spinal flexibility. Option B, leg length disparity. Option C, hypostatic blood pressure. Option D, scoliosis. The correct answer is option D, scoliosis. The Adams forward bend test is the standard screening tool used to detect the spinal curvature or rib hump associated with scoliosis. Question 85. Which characteristic is the nurse least likely to find in a parent who is abusing their child? Option A, low self-esteem. Option B, unemployment. Option C, self-blame for the injury. Option D, single status. The correct answer is option C, self-blame for the injury. Abusing parents often use denial or project blame onto the child. They rarely exhibit genuine self-blame or insight into the injury. Question 86. Which sign or symptom in a 4-year-old child following head trauma would be a cause for concern regarding increased ICP? Option A, bulging anterior fontanelle. Option B, repeated vomiting. Option C, signs of sleepiness at 10 p.m. Option D, inability to read short words from 18 inches. The correct answer is option B, repeated vomiting. In a 4-year-old, whose fontanelles are closed, repeated vomiting is a classic sign of increased intracranial pressure. Question 87. Which observation indicates that a non-immunized child may have rubella, measles? Option A, small blue-white spots visible on the oral mucosa. Option B, the rash begins on the trunk and spreads outward. Option C, there is low-grade fever. Option D, lesions have a teardrop on a rose petal appearance. The correct answer is option A, small blue-white spots visible on the oral mucosa. Colix spots, small blue-white spots on the inner cheeks, are a pathognomonic early sign of rubella. Question 88. Which description of scarlet fever is not correct? Option A, caused by group A streptococcus. Option B, a strawberry tongue is a characteristic sign. Option C, petechiae occur on the soft palate. Option D, the pharynx is red and swollen. The correct answer is option C, petechiae occur on the soft palate. While strep can cause petechiae, they are not a defining characteristic of scarlet fever as much as the sandpaper rash and strawberry tongue are. Question 89. A 30 kg child is prescribed Benadryl 25 mg 3x/day. The correct dose is 5 mg/kg/day. Which describes this dose? Option A, it is the correct dose. Option B, the dose is too low. Option C, the dose is too high. Option D, the dose should be increased or decreased depending on symptoms. The correct answer is option B, the dose is too low. Calculation: 30 kg * 5 mg equals 150 mg per day. The current order, 25 mg 3, is 75 mg per day, which is half of the recommended dose. Question 90. Regarding an undescended testis in a 2-month-old, which statement is most accurate? Option A. Normally, the testes are descended by birth. Option B. The infant will likely require surgical intervention. Option C. The infant probably has only one testis. Option D. Anormally, the testes descend by 1 year of age. The correct answer is option A. Normally, the testes are descended by birth. In most full-term infants, the testes have already descended into the scrotal sac by the time of birth. Question 91. Nurse Jenny is instilling an otic solution into an adult male client's left ear. Nurse Jenny avoids doing which of the following as part of the procedure? Option A. Pulling the auricle backward and upward. Option B. Warming the solution to room temperature. Option C. Placing the tip of the dropper on the edge of the ear canal. Option D. Placing the client in a side-lying position. The correct answer is option C. Placing the tip of the dropper on the edge of the ear canal. The nurse should avoid touching the ear canal with the dropper tip to prevent contamination of the medication bottle. Question 92. Nurse BEA should instruct the male client with an ileostomy to report which of the following symptoms? Option A. Absence of drainage from the ileostomy for 6 or more hours. Option B. Passage of liquid stool in the stoma. Option C. Occasional presence of undigested food. Option D. A temperature of 37.6 degrees Celsius. The correct answer is option A. Absence of drainage from the ileostomy for 6 or more hours. Absence of drainage for 6 or more hours in an ileostomy is a sign of a potential bowel obstruction and must be reported immediately. Question 93. Jerry has been diagnosed with appendicitis. He develops a fever, hypotension, and tachycardia. The nurse suspects which of the following complications? Option A. Intestinal obstruction. Option B. Peritonitis. Option C. Bowel ischemia. Option D. Deficient fluid volume. The correct answer is option B. Peritonitis. Fever, hypotension, and tachycardia in a patient with appendicitis are classic signs of peritonitis following a ruptured appendix. Question 94. Which of the following complications should the nurse carefully monitor a client with acute pancreatitis? Option A. Myocardial infarction. Option B. Cirrhosis. Option C. Peptic ulcer. Option D. Pneumonia. The correct answer is option D. Pneumonia. Acute pancreatitis can cause respiratory complications such as pleural effusion, atelectasis, and pneumonia due to inflammatory mediators. Question 95. Which of the following symptoms during the icteric phase of viral hepatitis should the nurse expect the client to inhibit? Option A. Watery stool. Option B. Yellow sclera. Option C. Tarry stool. Option D. Shortness of breath. The correct answer is option B. Yellow sclera. The icteric phase is characterized by the onset of jaundice, which is most easily observed as yellowing of the sclera. Question 96. Marco, who was diagnosed with a brain tumor, was scheduled for craniotomy. In preventing the development of cerebral edema after surgery, the nurse should expect the use of Option A. Diuretics. Option B. Antihypertensive. Option C. Steroids. Option D. Anticonvulsants. The correct answer is option C. Steroids. Dexamethasone, a steroid, is commonly used post-craniotomy to reduce inflammation and prevent cerebral edema. Question 97. Halfway through the administration of blood, the female client complains of lumbar pain. After stopping the infusion, Nurse Hazel should: Option A. Increase the flow of normal saline. Option B. To assess the pain further. Option C. Notify the blood bank. Option D. To obtain vital signs. The correct answer is option A. Increase the flow of normal saline. After stopping a transfusion for a suspected reaction, the nurse must keep the line open with normal saline to maintain access for emergency meds. Question 98. Nurse Maureen knows that the positive diagnosis of HIV infection is made based on which of the following? Option A. A history of high-risk sexual behaviors. Option B. Positive ELISA and Western blot tests. Option C. Identification of an associated opportunistic infection. Option D. Evidence of extreme weight loss and high fever. The correct answer is option B. Positive ELISA and Western blot tests. A positive ELISA followed by a confirmatory Western blot test is the standard diagnostic protocol for HIV. Question 99. A client with chronic renal failure recognizes an adequate amount of high biological value protein when they select option A, raw carrots, option B, apple juice, option C, whole wheat bread, option D, cottage cheese. The correct answer is option D, cottage cheese. High biological value proteins contain all essential amino acids. Dairy products like cottage cheese are excellent sources for CRF patients. Question 100. Kenneth, who was diagnosed with uremic syndrome, has the potential to develop complications. Which among the following should the nurse anticipate? Option A, flapping hand tremors. Option B, an elevated hematocrit level. Option C, hypotension. Option D, hypokalemia. The correct answer is option A, flapping hand tremors. Asterixis, flapping hand tremors, is a common neurological finding in patients with uremic syndrome or hepatic encephalopathy. Question 101. A client is admitted to the hospital with benign prostatic hyperplasia. The nurse's most relevant assessment would be option A, flank pain radiating in the groin. Option B, distension of the lower abdomen. Option C, perineal edema. Option D, urethral discharge. The correct answer is option B, distension of the lower abdomen. BPH causes urinary retention, which leads to a distended bladder that can be palpated in the lower abdomen. Question 102. A client has undergone a penile implant. After 24 hours, the client's scrotum was edema-2 and painful. The nurse should option A, assist the client with sitz bath. Option B, apply warm soaks in the scrotum. Option C, elevate the scrotum using a soft support. Option D, prepare for a possible incision and drainage. The correct answer is option C, elevate the scrotum using a soft support. Elevation of the scrotum reduces edema and provides comfort following genital or pelvic surgery. Question 103. Nurse Hazel receives emergency results for a client with chest pain. An increased myoglobin level suggests option A, liver disease. Option B, myocardial damage. Option C, hypertension. Option D, cancer. The correct answer is option B, myocardial damage. Myoglobin is one of the first markers to rise following myocardial damage, though it is not as specific as troponin. Question 104. Nurse Maureen would expect a client with mitral stenosis to demonstrate symptoms associated with congestion in the option A, right atrium. Option B, superior vena cava. Option C, aorta. Option D, pulmonary system. The correct answer is option D, pulmonary system. Mitral stenosis causes blood to back up into the left atrium and subsequently into the pulmonary veins and lungs. Question 105. A client has been diagnosed with hypertension. The nurse's priority nursing diagnosis would be option A, ineffective health maintenance. Option B, impaired skin integrity. Option C, deficient fluid volume. Option D, pain. The correct answer is option A, ineffective health maintenance. Hypertension is often asymptomatic, and the biggest challenge is ensuring the patient maintains their treatment and lifestyle changes. Question 106. Nurse Hazel teaches the client with angina about common expected side effects of nitroglycerin, including option A, high blood pressure. Option B, stomach cramps. Option C, headache. Option D, shortness of breath. The correct answer is option C, headache. Nitroglycerin causes systemic vasodilation, which frequently results in a throbbing headache as a side effect. Question 107. Which of the following is a risk factor for the development of atherosclerosis in PVD? Option A, high levels of low-density lipid, LDL, cholesterol. Option B, high levels of high-density lipid, HDL, cholesterol. Option C, low-concentration triglycerides. Option D, low levels of LDL cholesterol. The correct answer is option A, high levels of low-density lipid, LDL, cholesterol. Elevated LDL, the bad cholesterol, is a major contributor to the formation of plaque in the arteries. Question 108. Which of the following represents a significant risk immediately after surgery for repair of aortic aneurysm? Option A, potential wound infection. Option B, potential ineffective coping. Option C, potential electrolyte imbalance. Option D, potential alteration in renal perfusion. The correct answer is option D, potential alteration in renal perfusion. Surgical repair of an aortic aneurysm involves cross-clamping the aorta, which carries a significant risk of impaired blood flow to the kidneys. Question 109. Nurse Josie should instruct the client to eat which of the following foods to obtain the best supply of vitamin B12? Option A, dairy products. Option B, of vegetables. Option C, grains. Option D, broccoli. The correct answer is option A, dairy products. Vitamin B12 is found naturally in animal products, including meat, eggs, and dairy. It is absent in plant foods. Question 110. Karen has been diagnosed with aplastic anemia. The nurse monitors for changes in which of the following? Option A, bowel function. Option B, peripheral sensation. Option C, bleeding tendencies. Option D, intake and output. The correct answer is option C, bleeding tendencies. Aplastic anemia involves pancytopenia, a low platelet count. Thrombocytopenia leads to significant bleeding tendencies. Question 111. Lydia is scheduled for elective splenectomy. Before the client goes to surgery, the nurse in charge's final assessment would be: Option A, signed consent. Option B, of vital signs. Option C, name band. Option D, empty bladder. The correct answer is option B, vital signs. A final set of vital signs provides the baseline for the surgical team and ensures the patient is stable enough to proceed. Question 112. What is the peak age range for acquiring acute lymphocytic leukemia, ALL? Option A, 4 to 12 years. Option B, 20 to 30 years. Option C, 40 to 50 years. Option D, 60 to 70 years. The correct answer is option A, 4 to 12 years. ALL is the most common childhood malignancy, with a peak incidence occurring between the ages of 4 and 12 years. Question 113. Marie with ALL suffers from nausea and headache. These clinical manifestations may indicate: Option A, effects of radiation. Option B, chemotherapy side effects. Option C, meningeal irritation. Option D, gastric distension. The correct answer is option C, meningeal irritation. In ALL, leukemic cells can cross the blood-brain barrier, leading to meningeal irritation and increased intracranial pressure. Question 114. Which of the following is contraindicated for a client diagnosed with disseminated intravascular coagulation, DIC? Option A, administering heparin. Option B, administering Coumadin. Option C, treating the underlying cause. Option D, replacing depleted blood products. The correct answer is option B, administering Coumadin. Coumadin is a long-term oral anticoagulant and is not used in the management of acute DIC. It would be inappropriate and potentially dangerous. Question 115. Which finding is the best indication that fluid replacement for the client with hypovolemic shock is adequate? Option A, urine output greater than 30 milliliters per hour. Option B, a respiratory rate of 21 breaths/minute. Option C, diastolic blood pressure greater than 90 mmHg. Option D, systolic blood pressure greater than 110 mmHg. The correct answer is option A, urine output greater than 30 milliliters per hour. Urine output of 30 ml/hr or more is the gold standard indicator of adequate organ perfusion and successful fluid resuscitation. Question 116. Which of the following would the nurse include in a teaching plan as an early manifestation of laryngeal cancer? Option A, stomatitis. Option B, airway obstruction. Option C, hoarseness. Option D, dysphagia. The correct answer is option C, hoarseness. Persistent hoarseness is the most common early sign of laryngeal cancer due to the tumor's effect on the vocal cords. Question 117. Immunosuppressive therapy for myasthenia gravis is effective because it: Option A, promotes the removal of antibodies. Option B, stimulates acetylcholine production. Option C, decreases production of autoantibodies. Option D, inhibits the breakdown of acetylcholine. The correct answer is option C, decreases production of autoantibodies. MG is an autoimmune disease where antibodies attack acetylcholine receptors. Immunosuppression lowers the count of these autoantibodies. Question 118. A female client is receiving formanitol. An assessment specific to safe administration of this drug is: Option A, a vital signs Q4H. Option B, weighing daily. Option C, urine output hourly. Option D, a level of consciousness Q4H. The correct answer is option C, urine output hourly. Mannitol is an osmotic diuretic. Hourly urine output monitoring is required to ensure the kidneys can handle the fluid shift and prevent heart failure. Question 119. What is the primary advantage of using a pen-like insulin delivery device over traditional syringes? Option A, accurate dose delivery. Option B, shorter injection time. Option C, lower cost. Option D, use of a smaller gauge needle. The correct answer is option A, accurate dose delivery. Insulin pens are designed for high precision in dosing, which is their primary clinical advantage over manually drawn syringes. Question 120. To assess for damage to major blood vessels from a fractured tibia, the nurse should monitor for option A, swelling of the left thigh. Option B, increased skin temperature of the foot. Option C, prolonged reperfusion of the toes after blanching. Option D, increased blood pressure. The correct answer is option C, prolonged reperfusion of the toes after blanching. Capillary refill, reperfusion, is a direct measure of peripheral arterial blood flow. A delay suggests vascular damage from the fracture. Question 121. A 65-year-old man is admitted for spinal stenosis surgery. He lives alone in a 2-story house. When should the nurse initiate discharge training and planning? Option A, following surgery. Option B, upon admission. Option C, within 48 hours of discharge. Option D, preoperative discussion. The correct answer is option B, upon admission. Discharge planning should begin upon admission, or even preoperatively, to ensure all home care needs and potential barriers are addressed early. Question 122. A 5-year-old child appears hesitant to play and frequently asks if it is okay to play with certain toys. Which Erikson stage is the child primarily navigating? Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame and doubt. Option D, intimacy versus isolation. The correct answer is option B, initiative versus guilt. Children aged 3 to 6 years are in the initiative versus guilt stage. Excessive hesitation or seeking permission may indicate a struggle with guilt over self-initiated play. Question 123. A 26-month-old toddler is becoming increasingly assertive, wanting to dress themselves, but becomes frustrated and ashamed if they fail. Which Erikson stage is this? Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame and doubt. Option D, intimacy versus isolation. The correct answer is option C, autonomy versus shame and doubt. Toddlers, 1 to 3 years, are in the autonomy versus shame and doubt stage, where they strive for independence and self-control. Question 124. A 20-year-old young adult expresses concerns about a recent breakup and feels isolated from peers. Which Erikson stage is the young adult primarily navigating? Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame. Option D, intimacy versus isolation. The correct answer is option D, intimacy versus isolation. Young adults, 18 to 40 years, navigate intimacy versus isolation, focusing on forming deeply personal relationships. Question 125. Which of the following vital signs taken during a school health fair appears to be outside the typical range for the respective age group? Option A, the 11-year-old athlete, 90 bpm, 22 rpm, 100/70 mmHg. Option B, 13-year-old female, 105 bpm, 22 rpm, 105/50 mmHg. Option C, 5-year-old male, 102 bpm, 24 rpm, 90/65 mmHg. Option D is 6-year-old female, 100 bpm, 26 rpm, 90/70 mmHg. The correct answer is option B, 13-year-old female, 105 bpm, 22 rpm, 105/50 mmHg. For a 13-year-old, a diastolic blood pressure of 50 mmHg is lower than the typical range, especially alongside a slightly elevated heart rate. Question 126. A 38-year-old female struggles with depression and an anxiety disorder. Which of the following medications is most likely prescribed for these conditions? Option A, amitriptyline, Elaval. Option B, calcitonin. Option C, pergolide mesilate, Permax. Option D, verapamil, Calin. The correct answer is option A, amitriptyline, Elaval. Amitriptyline is a tricyclic antidepressant, TCA, commonly used to treat depression and sometimes off-label for anxiety. Question 127. A patient has a history of respiratory infection, Legionnaire's disease, and multiple sclerosis, MS. For which condition would the nurse question the administration of erythromycin? Option A. Recent bacterial respiratory infection. Option B. Past episode of Legionnaire's disease. Option C. Family history of campylobacteriosis. Option D. Long-standing diagnosis of multiple sclerosis. The correct answer is option D. Long-standing diagnosis of multiple sclerosis. Erythromycin is an antibiotic used for bacterial infections. It has no therapeutic role in treating multiple sclerosis, which is a neurological autoimmune disease. Question 128. Based on a history of hyperkalemia, which of the following symptoms reported by the patient would the nurse consider unrelated to an acute episode? Option A. Decreased HR. Option B. Paresthesias. Option C. Muscle weakness of the extremities. Option D. Migraines. The correct answer is option D. Migraines. Hyperkalemia, high potassium, affects muscle and cardiac function, weakness, bradycardia, paresthesia, but is not a cause of migraines. Question 129. A patient is suspected of having diabetic ketoacidosis, DKA. Which of the following symptoms reported by the patient would the nurse consider atypical for this condition? Option A. Persistent nausea and vomiting. Option B. An insatiable feeling of thirst, polydipsia. Option C. A noticeable increase in weight over a short period. Option D. A distinct fruity odor on the breath. The correct answer is option C. A noticeable increase in weight over a short period. DKA typically causes dehydration and fluid loss, leading to weight loss, not a short-term increase in weight. Question 130. A nurse suspects acute meningitis in a patient. Which of the following symptoms reported by the patient would the nurse consider not expected for this condition? Option A. A sudden increase in appetite. Option B. Episodes of vomiting. Option C. High fever and chills. Option D. Sensitivity to light, photophobia. The correct answer is option A. A sudden increase in appetite. Meningitis typically causes nausea and a lack of appetite, anorexia, not an increase in appetite. Question 131. A patient has red, itchy eyes with a yellowish discharge. Which microorganism is most likely responsible for this bacterial conjunctivitis? Option A. Yersinia pestis. Option B. Helicobacter pylori. Option C. Vibrio cholerae. Option D. Haemophilus aegyptius. The correct answer is option D. Haemophilus aegyptius. Haemophilus aegyptius is a common causative agent of acute bacterial conjunctivitis, pink eye. Question 132. A patient with a bullseye rash and joint pain has Lyme disease. Which microorganism is responsible? Option A. Borrelia burgdorferi. Option B. Streptococcus pyogenes. Option C. Bacillus anthracis. Option D. Enterococcus faecalis. The correct answer is option A. Borrelia burgdorferi. Lyme disease is caused by the bacterium Borrelia burgdorferi, transmitted through the bite of infected black-legged ticks. Question 133. An 87-year-old female has increased confusion, falls, and mild left hemiparesis. Which test is most likely to be performed? Option A. CBC, complete blood count. Option B. PCG, electrocardiogram. Option C. Thyroid function tests. Option D. CT scan. The correct answer is option D. CT scan. Sudden onset of hemiparesis, weakness on one side, and confusion in the elderly necessitates a CT scan to rule out a stroke or intracranial bleed. Question 134. An 85-year-old male is losing mobility, gaining weight, and runs the heater even on warm days. Which test is most likely to be performed? Option A. CBC, complete blood count. Option B. PCG, electrocardiogram. Option C. Thyroid function tests. Option D. CT scan. The correct answer is option C. Thyroid function tests. Weight gain, lethargy, and cold intolerance, running the heater, are classic symptoms of hypothyroidism, requiring thyroid function testing. Question 135. A 20-year-old college student is found unconscious with a fever and a rash. Which of the following tests is most likely to be performed first? Option A. Blood sugar check. Option B. CT scan. Option C. Blood cultures. Option D. Arterial blood gases. The correct answer is option C. Blood cultures. Fever, rash, and altered consciousness in a young adult suggest meningococcemia or meningitis. Blood cultures are a priority for identifying the pathogen. Question 136. Which behavioral characteristic describes the domestic abuser? Option A, alcoholic. Option B, overconfident. Option C, high tolerance for frustrations. Option D, low self-esteem. The correct answer is option D, low self-esteem. Domestic abusers often have low self-esteem and use violence or control to compensate for feelings of inadequacy. Question 137. The nurse is caring for a client with a long leg cast. Which exercise should the nurse recommend for the affected extremity? Option A, high symmetric. Option B, range of motion. Option C, aerobic. Option D, isotonic. The correct answer is option A, isometric. Isometric exercises, contracting muscle without moving the joint, help prevent muscle atrophy while the limb is immobilized in a cast. Question 138. A woman in her first pregnancy has multiple sex partners and is unsure of the baby's father. Which intervention is a priority? Option A, counsel the woman to consent to HIV screening. Option B, perform tests for sexually transmitted diseases. Option C, discuss her high risk for cervical cancer. Option D, refer the client to a family planning clinic. The correct answer is option A, counsel the woman to consent to HIV screening. While all are important, counseling for HIV screening is a priority to prevent mother-to-child transmission during pregnancy. Question 139. A 16-month-old child clings to the mother and begins to cry when the nurse enters. What is the initial action by the nurse? Option A, arrange to change client care assignments. Option B, explain that this behavior is expected. Option C, discuss the appropriate use of timeout. Option D, explain that the child needs extra attention. The correct answer is option B, explain that this behavior is expected. Separation anxiety and fear of strangers are developmentally normal behaviors for a 16-month-old toddler. Question 140. While planning care for a 2-year-old hospitalized child, which situation is most likely to affect the behavior? Option A, strange bed and surroundings. Option B, separation from parents. Option C, presence of other toddlers. Option D, unfamiliar toys and games. The correct answer is option B, separation from parents. For a hospitalized toddler, the greatest stressor is typically separation from their primary caregivers, parents. Question 141. While explaining an illness to a 10-year-old, what should the nurse keep in mind about cognitive development? Option A, they make simple associations of ideas. Option B, they are able to think logically in organizing facts. Option C, interpretation originates from their own perspective. Option D, conclusions are based on previous experiences. The correct answer is option B, they are able to think logically in organizing facts. According to Piaget, 10-year-olds are in the concrete operational stage and can think logically about concrete facts and events. Question 142. The nurse has just admitted a client with severe depression. From which focus should the nurse identify a priority nursing diagnosis? Option A, nutrition. Option B, elimination. Option C, activity. Option D, safety. The correct answer is option D, safety. In severe depression, the risk of self-harm or suicide is the highest priority. Safety must be addressed before other concerns. Question 143. Which playroom activities should the nurse organize for a group of 7-year-old hospitalized children? Option A is sports and games with rules. Option B, finger paints and water play. Option C, dress-up clothes and props. Option D, chess and television programs. The correct answer is option A, sports and games with rules. School-age children, 6 to 12 years, enjoy competitive play and games that follow established rules. Question 144. A client is discharged following hospitalization for congestive heart failure. Which rest position is most helpful? Option A, high fowlers. Option B, supine. Option C, left lateral. Option D, low fowlers. The correct answer is option A, high fowlers. High fowlers, sitting upright, decreases venous return and eases the work of breathing, which is essential for CHF patients. Question 145. Which assessment parameter indicates that a 10-year-old on the burn unit has adequate fluid replacement? Option A, urinary output of 30 milliliters per hour. Option B, no complaints of thirst. Option C, increased hematocrit. Option D, good skin turgor around burn. The correct answer is option A, urinary output of 30 milliliters per hour. Urinary output of 0.5 to 1.0 ml/kg/hr, roughly 30 ml/hr for an average child, is the best indicator of adequate kidney perfusion and fluid resuscitation. Question 146. What is the priority nursing diagnosis for a patient experiencing a migraine headache? Option A, acute pain related to biologic and chemical factors. Option B, anxiety related to change in health status. Option C, hopelessness related to physiological condition. Option D, a risk for side effects related to medical therapy. The correct answer is option A, acute pain related to biologic and chemical factors. The hallmark of a migraine is severe, debilitating pain. Addressing acute pain is the immediate priority. Question 147. Which key item should be included in the teaching plan for newly diagnosed migraine headaches? Select all that apply. Option A, avoid foods with tyramine, alcohol, aged cheese. Option B, avoid drugs such as Tagamet and nitroglycerin. Option C, abortive therapy is aimed at the aura phase. Option D, medications can cause rebound headaches. The correct answer is option A, avoid foods with tyramine, alcohol, aged cheese. Avoiding triggers, like tyramine-rich foods, is a cornerstone of migraine prevention and management. Question 148. A patient has a seizure. After the seizure, which action can you delegate to the nursing assistant, UAP? Option A, document the seizure. Option B, perform neurologic checks. Option C, take the patient's vital signs. Option D, restrain the patient for protection. The correct answer is option C, take the patient's vital signs. Taking vital signs is within the scope of practice for a nursing assistant. Documentation and neurochecks require nursing judgment. Question 149. You are preparing to admit a patient with a seizure disorder. Which action can you delegate to the LPN/LVN? Option A, a complete admission assessment. Option B, set up oxygen and suction equipment. Option C, place a padded tongue blade at the bedside. Option D, pad the side rails before the patient arrives. The correct answer is option B, set up oxygen and suction equipment. LPNs can set up standard safety equipment. Padded tongue blades are contraindicated, and admission assessments must be done by an RN. Question 150. A student is teaching about epilepsy prior to discharge. For which statement should you intervene? Option A, you should avoid consumption of all alcohol. Option B, wear your medical alert bracelet at all times. Option C, protect your loved one's airway during a seizure. Option D, it's okay to take over-the-counter medications. The correct answer is option D, it's okay to take over-the-counter medications. The nurse must intervene because many OTC medications, like cold medicines, can lower the seizure threshold or interact with anti-epileptic drugs. Question 151. Which of the following conditions is linked to more than 50% of clients with abdominal aortic aneurysms? Option A, DM. Option B, HPN. Option C, PVD. Option D, syphilis. The correct answer is option B, HPN. Hypertension, HPN, is the leading cause of abdominal aortic aneurysms as the constant high pressure weakens the arterial wall over time. Question 152. Which of the following sounds is distinctly heard on auscultation over the abdominal region of an abdominal aortic aneurysm client? Option A, bruit. Option B, crackles. Option C, dullness. Option D, friction rubs. The correct answer is option A, bruit. A systolic bruit is a vascular sound heard over an aneurysm caused by the turbulent flow of blood through the dilated area. Question 153. Which of the following groups of symptoms indicated a ruptured abdominal aneurysm? Option A, lower back pain, increased BP, decreased RBC, increased WBC. Option B, severe lower back pain, decreased BP, decreased RBC, increased WBC. Option C, severe lower back pain, decreased BP, decreased RBC, decreased WBC. Option D, intermittent lower back pain, decreased BP, decreased RBC, increased WBC. The correct answer is option B, severe lower back pain, decreased BP, decreased RBC, increased WBC. A rupture presents with sudden severe pain and signs of hemorrhagic shock, decreased BP, decreased RBC count, and an elevated WBC count due to stress. Question 154. Which of the following complications of an abdominal aortic repair is indicated by detection of a hematoma in the perineal area? Option A, hernia. Option B, stage 1 pressure ulcer. Option C, retroperitoneal rupture at the repair site. Option D, rapid expansion of the aneurysm. The correct answer is option C, retroperitoneal rupture at the repair site. A hematoma in the perineum or scrotum, or flank ecchymosis, suggests that blood is leaking into the retroperitoneal space from the surgical site. Question 155. Which hereditary disease is most closely linked to an aneurysm? Option A, cystic fibrosis. Option B, lupus erythematosus. Option C, Marfan's syndrome. Option D, myocardial infarction. The correct answer is option C, Marfan's syndrome. Marfan's syndrome is a connective tissue disorder that weakens the structural integrity of the aorta, significantly increasing the risk of aneurysms. Question 156. Which of the following treatments is the definitive one for a ruptured aneurysm? Option A, antihypertensive medication administration. Option B, aortogram. Option C, beta-adrenergic blocker administration. Option D, surgical intervention. The correct answer is option D, surgical intervention. A ruptured aneurysm is a life-threatening emergency. Immediate surgical repair is the only definitive treatment to stop hemorrhage. Question 157. Which of the following heart muscle diseases is unrelated to other cardiovascular diseases? Option A, cardiomyopathy. Option B, coronary artery disease. Option C, myocardial infarction. Option D, pericardial effusion. The correct answer is option A, cardiomyopathy. Cardiomyopathy is a primary disease of the heart muscle itself and is often not a result of other conditions like CAD or ME. Question 158. Which of the following types of cardiomyopathy can be associated with childbirth? Option A, dilated. Option B, hypertrophic. Option C, myocarditis. Option D, restrictive. The correct answer is option A, dilated. Peripartum cardiomyopathy is a form of dilated cardiomyopathy that occurs in late pregnancy or the first few months following delivery. Question 159. Septal involvement occurs in which type of cardiomyopathy? Option A, congestive. Option B, dilated. Option C, hypertrophic. Option D, restrictive. The correct answer is option C, hypertrophic. Hypertrophic cardiomyopathy often involves asymmetric septal hypertrophy, which can lead to left ventricular outflow tract obstruction. Question 160. Which of the following recurring conditions commonly occurs in clients with cardiomyopathy? Option A, heart failure. Option B, DM. Option C, ME. Option D, pericardial effusion. The correct answer is option A, heart failure. Structural changes in the heart muscle, regardless of the type of cardiomyopathy, eventually lead to the heart's inability to pump effectively, resulting in heart failure. Question 161. What is the term used to describe an enlargement of the heart muscle? Option A, cardiomegaly. Option B, cardiomyopathy. Option C, myocarditis. Option D, pericarditis. The correct answer is option A, cardiomegaly. Cardiomegaly literally translates to enlargement of the heart. Question 162. Dyspnea, cough, expectoration, weakness, and edema are classic signs and symptoms of which of the following conditions? Option A, pericarditis. Option B, hypertension. Option C, obliterative. Option D, restrictive. The correct answer is option D, restrictive. Restrictive cardiomyopathy presents with symptoms of congestive heart failure due to the heart's inability to fill properly during diastole. Question 163. Which of the following types of cardiomyopathy does not affect cardiac output? Option A, dilated. Option B, hypertrophic. Option C, restrictive. Option D, obliterative. The correct answer is option B, hypertrophic. In the early stages of hypertrophic cardiomyopathy, cardiac output is often maintained, though it may be compromised later if an obstruction develops. Question 164. Which of the following cardiac conditions does a fourth heart sound, S4, indicate? Option A, dilated aorta. Option B, normally functioning heart. Option C, decreased myocardial contractility. Option D, a failure of the ventricle to eject all blood. The correct answer is option C, decreased myocardial contractility. An S4 sound, atrial gallop, is produced when the atrium contracts against a stiff, non-compliant ventricle, often seen with decreased myocardial contractility. Question 165. Which of the following classes of drugs is widely used in the treatment of cardiomyopathy? Option A, antihypertensive. Option B, beta-adrenergic blockers. Option C, calcium channel blockers. Option D, nitrates. The correct answer is option B, beta-adrenergic blockers. Beta blockers are used to decrease heart rate and oxygen demand, allowing for better ventricular filling and reducing symptoms. Question 166. A 23-year-old client has substernal chest pain and a heart rate of 136. Breath sounds are clear. Which drug should the nurse question the client about using? Option A, barbiturates. Option B, opioids. Option C, cocaine. Option D, benzodiazepines. The correct answer is option C, cocaine. Cocaine is a potent sympathomimetic that causes rapid tachycardia, vasoconstriction, and myocardial ischemia, leading to substernal chest pain. Question 167. Which assessment finding would strongly suggest that a painless breast lump is cancerous? Option A, the evershown of the right nipple and mobile mass. Option B, non-mobile mass with irregular edges. Option C, mobile mass that is soft and easily delineated. Option D, non-palpable right axillary lymph nodes. The correct answer is option B, non-mobile mass with irregular edges. Malignant masses are typically hard, fixed to surrounding tissue, non-mobile, and have poorly defined or irregular borders. Question 168. A 35-year-old client with vaginal cancer asks about the usual treatment. Which treatment should the nurse name? Option A, surgery. Option B, chemotherapy. Option C, radiation. Option D, immunotherapy. The correct answer is option C, radiation. External beam or internal brachytherapy, radiation, is the most common primary treatment for vaginal cancer. Question 169. A biopsy report classifies a lesion as TIS, N0, M0. What does this classification mean? Option A, no evidence of primary tumor or metastasis. Option B, carcinoma in situ, no abnormal regional lymph nodes, and no distant metastasis. Option C, can't assess tumor or nodes. Option D, carcinoma in situ with ascending degrees of distant metastasis. The correct answer is option B, carcinoma in situ, no abnormal regional lymph nodes, and no distant metastasis. TIS stands for tumor in situ surface layer only, N0 means no lymph node involvement, and M0 means no distant metastasis. Question 170. When teaching a client how to care for a neck stoma after a laryngectomy, which instruction should be included? Option A, keep the stoma uncovered. Option B, keep the stoma dry. Option C, family must perform all care. Option D, keep the stoma moist. The correct answer is option D, keep the stoma moist. Maintaining moisture in the stoma is essential for wound healing and prevents the drying of secretions that can lead to airway obstruction. Question 171. Which type of cancer causes the most deaths in women? Option A, breast cancer. Option B, lung cancer. Option C, brain cancer. Option D, colon and rectal cancer. The correct answer is option B, lung cancer. While breast cancer is more common, lung cancer remains the leading cause of cancer-related mortality in women. Question 172. Antonio with lung cancer develops Horner's syndrome. When assessing for symptoms, the nurse should note: Option A, meiosis, partial eyelid ptosis, and anhidrosis on the affected side. Option B, chest pain, dyspnea, and cough. Option C, arm and shoulder pain with atrophy. Option D, hoarseness and dysphagia. The correct answer is option A, meiosis, partial eyelid ptosis, and anhidrosis on the affected side. Horner's syndrome is a triad of symptoms: drooping eyelid, ptosis, constricted pupil, meiosis, and lack of sweating, anhidrosis, caused by nerve interference. Question 173. Vic asks the nurse what PSA is. The nurse should reply that it stands for: Option A, prostate-specific antigen, which is used to screen for prostate cancer. Option B, protein serum antigen. Option C, pneumococcal strep antigen. Option D, P-panicola-specific antigen. The correct answer is option A, prostate-specific antigen, which is used to screen for prostate cancer. PSA is a protein produced by the prostate gland, Elevated levels can indicate inflammation, benign enlargement, or prostate cancer. Question 174. What is the most important postoperative instruction after a subarachnoid block, spinal anesthesia? Option A. Avoid drinking liquids until the gag reflex returns. Option B. Avoid eating milk products for 24 hours. Option C. Notify a nurse if you experience blood in your urine. Option D. Remain supine for the time specified by the physician. The correct answer is option D. Remain supine for the time specified by the physician. Remaining supine, flat, prevents the loss of cerebrospinal fluid through the puncture site, which helps prevent a postspinal headache. Question 175. A male client suspected of having colorectal cancer will require which diagnostic study to confirm the diagnosis? Option A. Stool hematist. Option B. Carcinoembryonic antigen, SEA. Option C. Sigmoidoscopy. Option D. Abdominal computed tomography, CT, scan. The correct answer is option C. Sigmoidoscopy. Direct visualization via sigmoidoscopy or colonoscopy allows for a tissue biopsy, which is the only way to definitively confirm cancer. Question 176. Which finding most strongly suggests that a woman has breast cancer? Option A. A slight asymmetry of the breasts. Option B. A fixed nodular mass with dimpling of the overlying skin. Option C. Bloody discharge from the nipple. Option D. Multiple firm, round, freely movable masses. The correct answer is option B. A fixed nodular mass with dimpling of the overlying skin. Skin dimpling, resembling an orange peel, and a fixed, immovable mass are characteristic indicators of invasive breast cancer. Question 177. A client with cancer is being evaluated for possible metastasis. Which of the following is one of the most common metastasis sites? Option A. Liver. Option B. Colon. Option C. Reproductive tract. Option D. White blood cells, WBCs. The correct answer is option A. Liver. The liver is a primary site for metastasis for many cancers because of its large size and rich, double blood supply. Question 178. During an MRI scan to rule out a spinal cord lesion, which of the following would pose a threat to the client? Option A. The client lies still. Option B. The client asks questions. Option C. The client hears thumping sounds. Option D. The client wears a watch and wedding band. The correct answer is option D. The client wears a watch and wedding band. MRI uses a high-powered magnet. Metal objects like watches or wedding bands can be pulled toward the magnet or cause thermal burns. Question 179. Which of the following teaching points about preventing osteoporosis is correct? Option A. Obtain an X-ray every 3 years to detect loss. Option B. Avoid strenuous exercise. Option C. The RDA of calcium may be found in a wide variety of foods. Option D. RDA of calcium requires taking a supplement. The correct answer is option C. The RDA of calcium may be found in a wide variety of foods. Calcium is widely available in dairy, green leafy vegetables, and fortified foods. Dietary intake is the preferred method of prevention. Question 180. Before Jacob undergoes arthroscopy, which finding is a contraindication for this procedure? Option A. Joint pain. Option B. Joint deformity. Option C. Joint flexion of less than 50%. Option D. Joint stiffness. The correct answer is option C. Joint flexion of less than 50%. Arthroscopy requires the joint to be maneuverable. If the client cannot flex the joint to at least 50%, the scope cannot be safely inserted. Question 181. During a routine checkup, Nurse Marianne assesses a male client with acquired immunodeficiency syndrome, AIDS, for signs and symptoms of cancer. What is the most common AIDS-related cancer? Option A. Squamous cell carcinoma. Option B. Multiple myeloma. Option C. Leukemia. Option D. Kaposi's sarcoma. The correct answer is option D. Kaposi's sarcoma. Kaposi's sarcoma is the most frequent malignancy associated with AIDS, presenting as purple or brown skin lesions caused by human herpes virus 8. Question 182. Ricardo is scheduled for a prostatectomy, and the anesthesiologist plans to use a spinal, subarachnoid, block during surgery. Why does the client require special positioning for this type of anesthesia? Option A. To prevent confusion. Option B. To prevent seizures. Option C. To prevent cerebrospinal fluid, CSF, leakage. Option D. to prevent cardiac arrhythmias. The correct answer is option C, to prevent cerebrospinal fluid (CSF) leakage. Proper positioning and remaining supine post-procedure are necessary to prevent CSF leakage through the dural puncture, which can result in a severe spinal headache. Question 183. A male client had a nephrectomy 2 days ago and is now complaining of abdominal pressure and nausea. The first nursing action should be to: Option A, auscultate bowel sounds. Option B, palpate the abdomen. Option C, change the client's position. Option D, insert a rectal tube. The correct answer is option A, auscultate bowel sounds. Postoperative abdominal pressure and nausea may indicate paralytic ileus. Auscultating for bowel sounds is the first assessment step to evaluate gastrointestinal motility. Question 184. Wilfredo, with a recent history of rectal bleeding, is being prepared for a colonoscopy. How should the nurse Patricia position the client for this test initially? Option A, lying on the right side with legs straight. Option B, lying on the left side with knees bent. Option C, prone with the torso elevated. Option D, bent over with hands touching the floor. The correct answer is option B, lying on the left side with knees bent. The left side lying (SIMS) position is used initially for colonoscopy because it follows the natural anatomy of the sigmoid colon, easing the insertion of the scope. Question 185. A male client with inflammatory bowel disease undergoes an ileostomy. On the first day after surgery, the client's stoma appears dusky. How should the nurse interpret this finding? Option A, a blood supply to the stoma has been interrupted. Option B, this is a normal finding 1 day after surgery. Option C, the ostomy bag should be adjusted. Option D, an intestinal obstruction has occurred. The correct answer is option A, blood supply to the stoma has been interrupted. A dusky, pale, or purple stoma indicates impaired tissue perfusion or ischemia and is a surgical emergency that must be reported immediately. Question 186. Anthony suffers burns on the legs. Which nursing intervention helps prevent contractures? Option A, applying knee splints. Option B, elevating the foot of the bed. Option C, hyperextending the client's palms. Option D, performing shoulder range of motion exercises. The correct answer is option A, applying knee splints. Splinting joints in a functional or extended position helps prevent the shortening of skin and connective tissue, contractures, during the healing process. Question 187. Nurse Ron is assessing a client with 2nd and 3rd degree burns on the face, arms, and chest. Which finding indicates a potential problem? Option A, partial pressure of arterial oxygen, PAO2, value of 80 mm Hg. Option B, urine output of 20 ml/hour. Option C, white pulmonary secretions. Option D, rectal temperature of 100.6 degrees Fahrenheit 38 degrees Celsius. The correct answer is option B, urine output of 20 ml/hour. Normal urine output should be at least 30 ml/hr. An output of 20 ml/hr in a burn patient suggests inadequate fluid resuscitation or impending acute kidney injury. Question 188. Mr. Mendoza has suffered a cerebrovascular accident, CVA, and is too weak to move. To help the client avoid pressure ulcers, Nurse Celia should: Option A, turn him frequently. Option B, perform passive range of motion, ROM, exercises. Option C, reduce the client's fluid intake. Option D, encourage the client to use a footboard. The correct answer is option A, turn him frequently. Repositioning the patient at least every 2 hours is the most effective nursing intervention to relieve pressure and prevent skin breakdown. Question 189. Nurse Maria plans to administer dexamethasone cream to a client who has dermatitis over the anterior chest. How should the nurse apply this topical agent? Option A, with a circular motion, to enhance absorption. Option B, with an upward motion, to increase blood supply. Option C, in long, even, outward, and downward strokes in the direction of hair growth. Option D, in long, even, outward, and upward strokes opposite the direction of hair growth. The correct answer is option C, in long, even, outward, and downward strokes in the direction of hair growth. Applying topical medications in the direction of hair growth helps prevent irritation of the follicles, folliculitis, and ensures even distribution. Question 190. Which class of medication protects the ischemic myocardium by blocking catecholamines and sympathetic nerve stimulation? Option A, beta-adrenergic blockers. Option B, calcium channel blocker. Option C, narcotics. Option D, nitrates. The correct answer is option A, beta-adrenergic blockers. Beta blockers block the effects of catecholamines like adrenaline, decreasing heart rate and myocardial oxygen demand, which protects the heart after a knee. Question 191. A male client has jugular distension. In what position should the nurse place the head of the bed to obtain the most accurate reading of jugular vein distension? Option A, high Fowler's. Option B, raised 10 degrees. Option C, raised 30 degrees. Option D, supine position. The correct answer is option C, raised 30 degrees. Jugular venous distension, JVD, is most accurately assessed with the head of the bed elevated at a 30 to 45 degree angle. Question 192. Which class of medications maximizes cardiac performance in clients with heart failure by increasing ventricular contractility? Option A, beta-adrenergic blockers. Option B, calcium channel blocker. Option C, diuretics. Option D, inotropic agents. The correct answer is option D, inotropic agents. Positive inotropic agents, such as digoxin, increase the strength of the heart's contractions, thereby improving cardiac output in heart failure patients. Question 193. A male client has reduced HDL and elevated LDL levels. Which of the following dietary modifications is not appropriate for this client? Option A, fiber intake of 25 to 30 g daily. Option B, less than 30% of calories from fat. Option C, cholesterol intake of less than 300 mg daily. Option D, less than 10% of calories from saturated fat. The correct answer is option C, cholesterol intake of less than 300 mg daily. For clients with high-risk lipid profiles, dietary cholesterol should be limited to less than 200 mg daily. 300 mg is the limit for the general healthy population. Question 194. A 37-year-old male was admitted with acute knee. Which of the following actions would breach the client's confidentiality? Option A, a verbal report to the telemetry nurse before transfer. Option B, notifying the on-call physician about a change in condition. Option C, head nurse checks the latest ECG results to check the client's progress. Option D, at the client's request, the nurse updates the client's wife. The correct answer is option C, head nurse checks the latest ECG results to check the client's progress. Hospital staff who are not currently assigned to the patient's care have no legal right to access the patient's medical records or test results. Question 195. During a pause in compressions, the cardiac monitor shows narrow QRS complexes and a HR of 70 with a palpable pulse. Which action should the nurse take first? Option A, start an IV line and administer amiodarone. Option B, check endotracheal tube placement. Option C, obtain an arterial blood gas, ABG, sample. Option D, administer atropine, 1 mg LV. The correct answer is option B, check endotracheal tube placement. When a pulse returns, ROSC, during advanced life support, confirming a patent in correctly placed airway, ET tube, is the first priority for stabilizing the patient. Question 196. Alvin with a massive pulmonary embolism will have an ABG performed. The acid-base disorder that may be present is? Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. Option D, respiratory alkalosis. The correct answer is option D, respiratory alkalosis. A pulmonary embolism causes hypoxia, which leads to hyperventilation. The excessive loss of CO2 results in respiratory alkalosis. Question 197. Armand is admitted with a pneumothorax and a chest tube is inserted. Bubbling appears in the water seal chamber. Which is the most likely cause? Option A, air leak. Option B, adequate suction. Option C, inadequate suction. Option D, kinked chest tube. The correct answer is option A, air leak. Continuous bubbling in the water seal chamber indicates an air leak, either in the patient's pleural space or within the drainage system itself. Question 198. Postoperative client receives 3,000 milliliters of Ringer's lactate over 24 hours. The drop factor is 10. How many drops per minute? Option A, 18. Option B, 21. Option C, 35. Option D, 40. The correct answer is option B, 21. Calculation: 3000 ml x 10 GTT / 24 hours x 60 minutes equals 30,000/1440 equals 20.83, which rounds to 21 drops per minute. Question 199. Mickey is ordered digoxin, Lanoxin, 0.12 mg. The bottle contains 0.05 mg in 1 milliliter. What amount should the nurse administer? Option A 1.2 milliliters. Option B 2.4 milliliters. Option C 3.5 milliliters. Option D 4.2 milliliters. The correct answer is option B, 2.4 milliliters. Calculation 0.12 milligrams / 0.05 mg / ml equals 2.4 ml. Question 200. Nurse Alexandra teaches a client about elastic stockings. Which statement indicates the teaching was successful? Option A. I will wear the stockings until the physician tells me to remove them. Option B. I should wear the stockings even when I am asleep. Option C. Every 4 hours I should remove the stockings for a half hour. Option D. I should put on the stockings before getting out of bed in the morning. The correct answer is option D. I should put on the stockings before getting out of bed in the morning. Elastic, TED, stockings should be applied before the client gets out of bed, while the veins are less congested and the legs are least swollen. Question 201. The primary reason for rapid continuous revarming of the area affected by frostbite is to: Option A. Lessen the amount of cellular damage. Option B. Prevent the formation of blisters. Option C. Promote movement. Option D. Prevent pain and discomfort. The correct answer is option A. Lessen the amount of cellular damage. Rapid revarming in water, 104 to 108 degrees Fahrenheit, helps to quickly restore blood flow and stop the freezing process, which minimizes cellular death and tissue loss. Question 202. A client asks how hemodialysis will take the place of his kidneys. Hemodialysis works by: Option A. Passing water through a jelly zinc membrane. Option B. Eliminating plasma proteins from the blood. Option C. Lowering the pH by removing non-volatile acids. Option D. Filtering waste through a jelly zinc membrane. The correct answer is option D. Filtering waste through a jelly zinc membrane. Hemodialysis uses the principle of diffusion to move nitrogenous waste products and excess electrolytes from the blood across a semi-permeable membrane. Question 203. A client with AIDS tells the nurse that he has been exposed to measles. Which action by the nurse is most appropriate? Option A. Administer an antibiotic. Option B. Contact the physician for an order for immune globulin. Option C. Administer an antiviral. Option D. Tell the client that he should remain in isolation for 2 weeks. The correct answer is option B. Contact the physician for an order for immune globulin. Immune globulin provides passive immunity and can prevent or modify measles in an immunocompromised person if given shortly after exposure. Question 204. A client with MRSA is on contact precautions. Which statement is true regarding these precautions? Option A. The client should be placed in a room with negative pressure. Option B. The door may remain open. Option C. The client should wear a mask at all times. Option D. Infection is prevented by hand washing, gloves, and a gown. The correct answer is option D. Infection is prevented by hand washing, gloves, and a gown. Contact precautions are designed to prevent transmission by direct or indirect contact. Required PPE includes gloves and a gown when entering the room. Question 205. A client with an above-the-knee amputation tells the nurse that his foot hurts and itches. Which response indicates an understanding? Option A. The pain will go away in a few days. Option B. The pain is due to peripheral nervous system interruptions. I will get you some pain medication. Option C. The pain is psychological. Option D. The pain and itching are due to infection. The correct answer is option B. The pain is due to peripheral nervous system interruptions. I will get you some pain medication. Phantom limb sensation is a real physical sensation caused by nerve endings in the stump sending signals to the brain. It requires pharmacological management. Question 206. A client with cancer of the pancreas has undergone a Whipple procedure. During this procedure, the doctor removes the: Option A. Head of the pancreas. Option B. Proximal third section of the small intestines. Option C. Stomach and duodenum. Option D. Esophagus and jejunum. The correct answer is option A. Head of the pancreas. The Whipple procedure, pancreaticoduodenectomy, involves the removal of the head of the pancreas, the duodenum, part of the jejunum, and the gallbladder. Question 207. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should avoid: Option A, packed fruits. Option B, salt. Option C, fresh raw pepper. Option D, ketchup. The correct answer is option C, fresh raw pepper. Neutropenic patients should avoid raw produce and certain spices like fresh pepper, as they can harbor high levels of bacteria and mold. Question 208. A client is discharged home with a prescription for Coumadin, sodium warfarin. The client should be instructed to: Option A, have a ProTime done monthly. Option B, eat more fruits and vegetables. Option C, drink more liquids. Option D, avoid crowds. The correct answer is option A, have a ProTime done monthly. Patients on warfarin must have their prothrombin time, patient, or international normalized ratio, INR, checked regularly to ensure the dosage is therapeutic. Question 209. The nurse is assisting with the removal of a central venous catheter. To facilitate removal, the nurse should instruct the client to: Option A, perform the Valsalva maneuver as the catheter is advanced. Option B, turn his head to the left side and hyperextend the neck. Option C, take slow, deep breaths as the catheter is removed. Option D, turn his head to the right while maintaining a sniffing position. The correct answer is option A, perform the Valsalva maneuver as the catheter is advanced. The Valsalva maneuver increases intrathoracic pressure, which prevents air from entering the central circulation, air embolism, as the catheter is withdrawn. Question 210. Before administering streptokinase, the nurse should assess the client for: Option A, a history of streptococcal infections. Option B, allergies to pineapples and bananas. Option C, prior therapy with phenytoin. Option D, a history of alcohol abuse. The correct answer is option A, a history of streptococcal infections. Streptokinase is derived from streptococci. A recent strep infection can result in high antibody titers that may neutralize the drug or cause an allergic reaction. Question 211. A 43-year-old African American male is admitted with sickle cell anemia. Which of the following outcome criteria would the nurse use to assess circulation in the lower extremities? Option A, body temperature of 99 degrees Fahrenheit or less. Option B, toes moved in active range of motion. Option C, sensation reported when soles of feet are touched. Option D, capillary refill of 3 seconds. The correct answer is option D, capillary refill of 3 seconds. Capillary refill is a direct assessment of peripheral tissue perfusion. In sickle cell anemia, vaso-occlusive crises can impair circulation, making refill time a critical metric. Question 212. A 30-year-old male is brought to the emergency department in sickle cell crisis. What is the best position for this client? Option A, side lying with knees flexed. Option B, knee chest. Option C, high fallers with knees flexed. Option D is semi-fallers with legs extended on the bed. The correct answer is option D, semi-fallers with legs extended on the bed. Flexing the knees or hips during a sickle cell crisis can further impede already compromised blood flow. Keeping the legs extended helps maximize circulation. Question 213. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of the highest priority? Option A, taking hourly blood pressures with mechanical cuff. Option B, encouraging fluid intake of at least 200 ml per hour. Option C, position in high fallers with knee gach raised. Option D, administering Tylenol as ordered. The correct answer is option B, encouraging fluid intake of at least 200 ml per hour. Hydration is the primary intervention for sickle cell crisis to reduce blood viscosity and prevent further sickling of red blood cells. Question 214. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat to assist with recovery? Option A, peaches. Option B, cottage cheese. Option C, popsicle. Option D, lima beans. The correct answer is option C, popsicle. Popsicles provide both comfort and much-needed hydration, which is essential for a patient in a vaso-occlusive crisis. Question 215. A client is complaining of severe pain in his feet and hands during a sickle cell crisis. The pulse oximetry is 92. Which intervention would be implemented first? Option A, adjust the room temperature. Option B, give a bolus of 4 fluids. Option C, start O2. Option D, administer meperidine, Demerol, 75 mg for push. The correct answer is option C. Start O2. Oxygenation is the priority, ABC, when the pulse oximeter shows hypoxia, 92%, and the patient is experiencing sickling, which is triggered by low oxygen. Question 216. The nurse is instructing a client with iron deficiency anemia on dietary choices. Which meal plan would the nurse expect the client to select? Option A: roast beef, gelatin salad, green beans, and peach pie. Option B: chicken salad sandwich, coleslaw, French fries, ice cream. Option C: egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie. Option D: pork chop, creamed potatoes, corn, and coconut cake. The correct answer is option A: roast beef, gelatin salad, green beans, and peach pie. Roast beef is a high source of heme iron, which is absorbed more efficiently by the body than non-heme sources. Question 217. The nurse is recommending activities for a client with sickle cell anemia to avoid hypoxia. Which activity is most appropriate? Option A: a family vacation in the Rocky Mountains. Option B: chaperoning the local boys' club on a snowskiing trip. Option C: a traveling by airplane for business trips. Option D: a bus trip to the Museum of Natural History. The correct answer is option D: a bus trip to the Museum of Natural History. High altitudes, mountains/plains, and extreme cold, skiing, can trigger a crisis. A low-altitude, indoor bus trip is the safest choice. Question 218. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which of the following would the nurse include in the physical assessment? Option A: palpate the spleen. Option B: take the blood pressure. Option C: examine the feet for petechiae. Option D: examine the tongue. The correct answer is option D: examine the tongue. Vitamin B12 deficiency, pernicious anemia, is often characterized by a smooth, beefy red tongue, known as glossitis. Question 219. An African American female is suspected of having vitamin B12 deficiency anemia. What body part would be the best indicator for jaundice? Option A: conjunctiva of the eye. Option B: soles of the feet. Option C: roof of the mouth. Option D: shins. The correct answer is option C: roof of the mouth. The hard palate, roof of the mouth, is one of the most reliable sites to assess for jaundice in individuals with dark skin. Question 220. The nurse is conducting a physical assessment on a client with anemia. Which clinical manifestation would be most indicative of the anemia? Option A: BP 146/88. Option B: respirations 28 shallow. Option C: weight gain of 10 pounds in 6 months. Option D: pink complexion. The correct answer is option B: respirations 28 shallow. Tachypnea, increased respiratory rate, is a compensatory mechanism used by the body to increase oxygen intake when hemoglobin is low. Question 221. The nurse is teaching a client with polycythemia vera about complication prevention. Which statement by the client indicates a need for further teaching? Option A: I will drink 500 ml of fluid or less each day. Option B: I will wear support hose when I am up. Option C: I will use an electric razor for shaving. Option D: I will eat foods low in iron. The correct answer is option A: I will drink 500 ml of fluid or less each day. Clients with polycythemia vera should stay well hydrated, usually 3 liters/day, to decrease blood viscosity and prevent clot formation. Question 222. A 33-year-old male is being evaluated for possible acute leukemia. Which of the following would the nurse inquire about as part of the assessment? Option A: the client collects stamps as a hobby. Option B: the client recently lost his job as a postal worker. Option C: the client had radiation for treatment of Hodgkin's disease as a teenager. Option D: the client's brother had leukemia as a child. The correct answer is option C: the client had radiation for treatment of Hodgkin's disease as a teenager. Previous exposure to radiation or chemotherapy, for other cancers like Hodgkin's, significantly increases the risk of developing acute leukemia later in life. Question 223. An African American client is admitted with acute leukemia. What is the best site for examining for the presence of petechiae? Option A: the abdomen. Option B: the thorax. Option C: the earlobes. Option D: the soles of the feet. The correct answer is option D: the soles of the feet. In dark-skinned clients, petechiae are most easily observed in lighter areas such as the palms of the hands or the soles of the feet. Question 224. A client with acute leukemia is admitted to the oncology unit. Which of the following would be most important for the nurse to inquire? Option A. Have you noticed a change in sleeping habits recently? Option B. Have you had a respiratory infection in the last 6 months? Option C. Have you lost weight recently? Option D. Have you noticed changes in your alertness? The correct answer is option B. Have you had a respiratory infection in the last 6 months? Infection is a major cause of death in leukemia patients due to neutropenia. A history of recent infections can indicate a compromised immune system. Question 225. Which of the following would be the priority nursing diagnosis for the adult client with acute leukemia? Option A. Whorl mucous membrane, altered related to chemotherapy. Option B. Risk for injury related to thrombocytopenia. Option C. Fatigue related to the disease process. Option D. Interrupted family processes. The correct answer is option B. Risk for injury related to thrombocytopenia. Thrombocytopenia puts the patient at extreme risk for spontaneous and life-threatening hemorrhage. Preventing injury and bleeding is the priority. Question 226. After the physician performs an amniotomy, the nurse's first action should be to assess the Option A. Degree of cervical dilation. Option B. Fetal heart tones. Option C. Client's vital signs. Option D. Client's level of discomfort. The correct answer is option B. Fetal heart tones. The priority after the membrane's rupture, amniotomy, is assessing fetal heart tones to ensure the umbilical cord hasn't prolapsed. Question 227. A vaginal exam determines that the client's cervix is 5 cm dilated with 75% effacement. The client is in which phase of labor? Option A. Active. Option B. Latent. Option C. A transition. Option D. Early. The correct answer is option A. Active. The active phase of the first stage of labor is typically defined by cervical dilation between 4 and 7 centimeters. Question 228. A newborn with narcotic abstinence syndrome is admitted. Nursing care of the newborn should include Option A. Teaching the mother to provide tactile stimulation. Option B. Wrapping the newborn snugly in a blanket. Option C. Placing the newborn in the infant seat. Option D. Initiating an early infant stimulation program. The correct answer is option B. Wrapping the newborn snugly in a blanket. Newborns experiencing withdrawal should be kept in a low stimulation environment. Swaddling snugly helps provide comfort and reduces irritability. Question 229. Following the initiation of epidural anesthesia, the nurse should give priority to Option A. Checking for cervical dilation. Option B. Placing the client in a supine position. Option C. Checking the client's blood pressure. Option D. Obtaining a fetal heart rate. The correct answer is option C. Checking the client's blood pressure. Maternal hypotension is a common side effect of epidural anesthesia, which can lead to decreased placental perfusion. Question 230. The nurse is aware that the best way to prevent postoperative wound infection in the surgical client is to Option A. Administer a prescribed antibiotic. Option B. Wash her hands for 2 minutes before care. Option C. Wear a mask when providing care. Option D. Ask the client to cover her mouth when she coughs. The correct answer is option B. Wash her hands for 2 minutes before care. Hand hygiene is the single most effective method for preventing the spread of infection and protecting surgical wounds. Question 231. The elderly client is admitted to the emergency room with a suspected fractured hip. Which symptom is the client most likely to exhibit? Option A. Pain. Option B. Misalignment. Option C. Cool extremity. Option D. Absence of pedal pulses. The correct answer is option B. Misalignment. A classic sign of a hip fracture is the shortening and external rotation of the affected leg, misalignment. Question 232. The nurse knows that a 60-year-old female client's susceptibility to osteoporosis is most likely related to Option A. Lack of exercise. Option B. Hormonal disturbances. Option C. Lack of calcium. Option D. Genetic predisposition. The correct answer is option B. Hormonal disturbances. The decrease in estrogen production following menopause is the leading cause of bone density loss in postmenopausal women. Question 233. A 2-year-old is in Bryant's traction for a fractured femur. Which finding indicates the traction is working properly? Option A. The infant no longer complains of pain. Option B. The buttocks are 15 degrees off the bed. Option C. The legs are suspended in the traction. Option D. The pins are secured within the pulley. The correct answer is option B. The buttocks are 15 degrees off the bed. In Bryant's traction, the buttocks must be slightly elevated off the mattress to provide the necessary countertraction. Question 234. Which statement is true regarding balanced skeletal traction? Option A utilizes a Steinman pin. Option B requires that both legs be secured. Option C utilizes Kirschner wires. Option D is used primarily to heal the fractured hips. The correct answer is option A, utilizes a Steinman pin. Skeletal traction involves the use of pins, like Steinman pins, or wires inserted directly into the bone for long-term immobilization. Question 235. Immediately following surgery for an open reduction internal fixation of a fractured hip, the nurse should give priority to assessing. Option A, serum collection, Davol, drain. Option B, client's pain. Option C, nutritional status. Option D, immobilizer. The correct answer is option A, serum collection, Davol, drain. Monitoring for excessive drainage or hemorrhage from the surgical site is the immediate postoperative priority. Question 236. Which statement by a family member indicates an understanding of the nurse's teaching regarding a percutaneous gastrostomy tube? Option A. I must flush the tube with water after feedings and clamp the tube. Option B. I must check placement 4 times per day. Option C. I will report to the doctor any signs of indigestion. Option D. If my father is unable to swallow, I will discontinue the feeding. The correct answer is option A. I must flush the tube with water after feedings and clamp the tube. Flushing the tube after feeding prevents clogging, and clamping the tube prevents the backflow of gastric contents. Question 237. A client is 2 hours post-total knee replacement. Which information requires notification of the doctor? Option A. A bleeding on the dressing is 3 centimeters in diameter. Option B. The client has a temperature of 100.6 degrees Fahrenheit 38.1 degrees Celsius. Option C. The client's hematocrit is 26%. Option D. The urinary output has been 60 during the last 2 hours. The correct answer is option C. The client's hematocrit is 26%. A hematocrit of 26% is significantly low, suggesting substantial blood loss during or after surgery that may require a transfusion. Question 238. The nurse is caring for a client with a 5-year-old diagnosis of plumbism. Which history is most likely related? Option A. The client has traveled out of the country in the last 6 months. Option B. The client's parents are skilled stained glass artists. Option C. The client lives in a house built in the 1970s. Option D. The client has several brothers and sisters. The correct answer is option B. The client's parents are skilled stained glass artists. Lead, plumbism, is used in the soldering process of stained glass. If parents are artists, the child may have been exposed to lead dust or fumes. Question 239. Which equipment would assist the client with a total hip replacement with activities of daily living? Option A. High seat commode. Option B. Recliner. Option C. TENS unit. Option D. Abduction pillow. The correct answer is option A. High seat commode. A high seat commode prevents the hip from flexing more than 90 degrees, which is a critical precaution to prevent prosthesis dislocation. Question 240. In anticipation of complications from anesthesia and narcotics in an elderly surgical client, the nurse should: Option A. Administer oxygen via nasal cannula. Option B. Have Narcan, naloxone, available. Option C. Prepare to administer blood products. Option D. Prepare to do cardio resuscitation. The correct answer is option B. Have Narcan, naloxone, available. Elderly patients are at higher risk for respiratory depression from narcotics. Naloxone, Narcan, should be readily available as an antidote. Question 241. A client with a history of abusing barbiturates abruptly stops taking the medication. The nurse should give priority to assessing the client for: Option A. Depression and suicidal ideation. Option B. Tachycardia and diarrhea. Option C. Muscle cramping and abdominal pain. Option D. Tachycardia and euphoric mood. The correct answer is option C. Muscle cramping and abdominal pain. Withdrawal from barbiturates is life-threatening and characterized by severe physical symptoms including muscle spasms, tremors, and abdominal pain. Question 242. During the assessment of a laboring client, the nurse notes that the FHT are loudest in the upper right quadrant. The infant is most likely in which position? Option A, right breech presentation. Option B, right occiput anterior presentation. Option C, left sacral anterior presentation. Option D, left occiput transverse presentation. The correct answer is option A, right breech presentation. Fetal heart tones heard in the upper quadrants of the abdomen usually indicate a breech presentation. Question 243. The primary physiological alteration in the development of asthma is: Option A, bronchial inflammation and dyspnea. Option B, hypersecretion of abnormally viscous mucus. Option C, infectious processes causing mucosal edema. Option D, spasm of bronchial smooth muscle. The correct answer is option D, spasm of bronchial smooth muscle. While asthma is a chronic inflammatory disease, the acute clinical manifestation is primarily caused by the spasm of bronchial smooth muscle, bronchospasm. Question 244. A client with mania is unable to finish her dinner. To help her maintain sufficient nourishment, the nurse should: Option A, serve high-calorie foods she can carry with her. Option B, encourage her appetite with favorite foods. Option C, serve her small, attractively arranged portions. Option D, allow her in the unit kitchen for extra food. The correct answer is option A, serve high-calorie foods she can carry with her. Clients in a manic state are often too hyperactive to sit for meals. Providing high-calorie finger foods allows them to eat while on the move. Question 245. To maintain Bryant's traction, the nurse must make certain that the child's: Option A, hips are resting on the bed. Option B, hips are slightly elevated above the bed. Option C, hips are elevated on a pillow. Option D, hips and legs are flat on the bed. The correct answer is option B, hips are slightly elevated above the bed. In Bryant's traction, the child's buttocks should be slightly elevated off the mattress to provide the necessary countertraction. Question 246. Which action by the nurse indicates understanding of the care for a client with herpes zoster? Option A, the nurse covers the lesions with a sterile dressing. Option B, the nurse wears gloves when providing care. Option C, the nurse administers a prescribed antibiotic. Option D, the nurse administers oxygen. The correct answer is option B, the nurse wears gloves when providing care. Herpes zoster, shingles, is transmissible through direct contact with the lesions, therefore, gloves must be worn during care. Question 247. A trough level is ordered for a client receiving vancomycin. The nurse should have the blood collected. Option A, 15 minutes after the infusion. Option B, 30 minutes before the infusion. Option C, 1 hour after the infusion. Option D, 2 hours after the infusion. The correct answer is option B, 30 minutes before the infusion. Trough levels are drawn when the medication is at its lowest concentration in the bloodstream, which is typically 30 minutes before the next dose. Question 248. The client using a diaphragm should be instructed to: Option A, refrain from keeping it in longer than 4 hours. Option B, keep the diaphragm in a cool location. Option C, have it resized if she gains 5 pounds. Option D, have it resized if she has any surgery. The correct answer is option B, keep the diaphragm in a cool location. Diaphragms should be stored in a cool, dry place to prevent the degradation of the rubber or silicone. Question 249. Which statement by a mother planning to breastfeed indicates the need for additional teaching? Option A, I'm wearing a support bra. Option B, I'm expressing milk from my breast. Option C, I'm drinking 4 glasses of fluid during a 24-hour period. Option D, I'll allow the water to run over my breasts in the shower. The correct answer is option C, I'm drinking 4 glasses of fluid during a 24-hour period. Breastfeeding mothers require significantly more hydration, typically 8 to 10 glasses of fluid per day, to maintain adequate milk production. Question 250. Damage to the 7 cranial nerve results in: Option A, facial pain. Option B, absence of ability to smell. Option C, absence of eye movement. Option D, tinnitus. The correct answer is option A, facial pain. Damage to the 7th cranial nerve, facial, affects facial expression and taste. However, it is frequently confused with the V nerve, trigeminal, which causes facial pain. Question 251. A client is receiving pyridium for a urinary tract infection. The client should be taught that the medication may: Option A, cause diarrhea. Option B, change the color of her urine. Option C, cause mental confusion. Option D, cause changes in taste. The correct answer is option B, change the color of her urine. Phenazopyridine, pyridium, is a urinary analgesic that typically turns the urine a bright orange or red color. Question 252. Which of the following tests should be performed before beginning a prescription of Accutane? Option A, check the calcium level. Option B, perform a pregnancy test. Option C, monitor apical pulse. Option D, obtain a creatinine level. The correct answer is option B, perform a pregnancy test. Isotretinoin, Accutane, is highly teratogenic. Female clients must have a negative pregnancy test before starting therapy and use strict contraception. Question 253. Which nursing intervention is most critical during the administration of acyclovir, Zovirax? Option A, limit the client's activity. Option B, encourage a high carbohydrate diet. Option C, utilize an incentive spirometer. Option D, encourage fluids. The correct answer is option D, encourage fluids. Acyclovir can cause renal damage due to crystal formation in the kidneys. Maintaining high fluid intake is essential to prevent nephrotoxicity. Question 254. A client is admitted for an MRI. The nurse should question the client regarding: Option A, pregnancy. Option B, a titanium hip replacement. Option C, allergies to antibiotics. Option D, inability to move his feet. The correct answer is option A, pregnancy. The nurse must verify the patient's pregnancy status and the presence of any ferromagnetic metal implants before an MRI. Question 255. The nurse is caring for a client receiving amphotericin B. Which finding indicates toxicity? Option A, changes in vision. Option B, nausea. Option C, urinary frequency. Option D, changes in skin color. The correct answer is option C, urinary frequency. Amphotericin B is highly nephrotoxic. Changes in urinary output or frequency can indicate early renal impairment. Question 256. A patient with congestive heart failure complains of dyspnea. Which action is the first the nurse should perform? Option A, ask the patient to lie down. Option B, draw blood for ABG. Option C, send the patient for a chest X-ray. Option D, check blood pressure. The correct answer is option D, check blood pressure. When a patient is in respiratory distress, the first priority is to assess vital signs to determine the patient's current clinical stability. Question 257. A patient prescribed nitroglycerin for angina complains of frequent headaches. Which response is correct? Option A, stop taking the nitroglycerin. Option B, go to the emergency department. Option C, headaches are a frequent side effect because it causes vasodilation. Option D, the headaches are unlikely to be related. The correct answer is option C, headaches are a frequent side effect because it causes vasodilation. Nitroglycerin is a potent vasodilator. Headache is the most common side effect due to the dilation of cerebral blood vessels. Question 258. A patient in remission from colon cancer complains of fatigue and difficulty with concentration. Which explanation accounts for this? Option A, the symptoms may be from anemia caused by chemotherapy. Option B, the patient may be immunosuppressed. Option C, the patient may be depressed. Option D, the patient may be dehydrated. The correct answer is option A, the symptoms may be from anemia caused by chemotherapy. Chemotherapy can cause lingering bone marrow suppression, leading to anemia which manifests as fatigue and chemobrain difficulty concentrating. Question 259. A clinic patient has a hemoglobin of 10.8 g/dl and is a strict vegetarian. Which advice is appropriate? Option A, the diet provides adequate iron. Option B, the patient should add meat to her diet. Option C, use iron cookware and eat dark green, leafy vegetables. Option D, add a cup of coffee or tea to every meal. The correct answer is option C, use iron cookware and eat dark green, leafy vegetables. Vegetarians can obtain sufficient iron by consuming non-heme iron sources like legumes and leafy greens and using iron cookware. Question 260. Which is the most accurate statement regarding a PRBC transfusion? Option A. Reaction is most likely after infusion is complete. Option B. PRBCs are best infused through a 20G catheter. Option C. PRBCs should be flushed with 5% dextrose. Option D. A nurse should remain in the room during the first 15 minutes. The correct answer is option D. A nurse should remain in the room during the first 15 minutes. The first 15 minutes are the most critical for identifying life-threatening acute hemolytic reactions. Question 261. Which patient at triage should be assigned the highest priority? Option A. Patient with low-grade fever and myalgias. Option B. Patient unable to bear weight on the left foot. Option C. Patient with abdominal and chest pain after a spicy meal. Option D. Child with a 1-inch bleeding laceration on the chin. The correct answer is option C. Patient with abdominal and chest pain after a spicy meal. Chest pain must always be treated as a potential myocardial infarction until proven otherwise, making it the highest triage priority. Question 262. A patient has a calcium level of 6.0 mg/dl. Which symptom would you not expect to see? Option A. Numbness in hands and feet. Option B. Muscle cramping. Option C. Hypoactive bowel sounds. Option D. Positive Kvostek's sign. The correct answer is option C. Hypoactive bowel sounds. Hypocalcemia, normal 8.5 to 10.5, causes neuromuscular irritability and hyperactive bowel sounds. Hypoactive sounds are seen in hypercalcemia. Question 263. A patient has an ing tube attached to low suction. Which ABG result might be expected? Option A. pH 7.52, PCO2 54 mmHg. Option B. pH 7.42, PCO2 40 mmHg. Option C. pH 7.25, PCO2 25 mmHg. Option D. pH 7.38, PCO2 36 mmHg. The correct answer is option A. pH 7.52, PCO2 54 mmHg. Loss of gastric acid via suctioning leads to metabolic alkalosis, elevated pH, with a compensatory increase in PCO2. Question 264. A patient scheduled for surgery is taking a high dose of warfarin. The nurse anticipates which action? Option A. Draw blood for patient and INR level. Option B. Administer vitamin K. Option C. Draw blood for type and crossmatch. Option D. Cancel the surgery immediately. The correct answer is option A. Draw blood for patient and INR level. The surgeon needs to know the patient's current coagulation status, patient/INR, to determine if it is safe to proceed with the procedure. Question 265. Which of the following laboratory results are abnormal? Select all that apply. Option A. Hemoglobin 10.4 g/dl. Option B. Total cholesterol 340 mg/dl. Option C. Total serum protein 7.0 g/dl. Option D. A1C 5.4%. The correct answer is option B. Total cholesterol 340 mg/dl. A cholesterol level of 340 is significantly elevated, normal 200. Hemoglobin 10.4 is also low, normal 12 to 16. Question 266. Which statement about juvenile idiopathic arthritis is most accurate? Option A. Poor chance of recovery without deformity. Option B. Most progress to adult RA. Option C. Nonsteroidal anti-inflammatory drugs are the first choice. Option D. Physical activity should be minimized. The correct answer is option C. Nonsteroidal anti-inflammatory drugs are the first choice. NSAIDs are the primary first-line treatment to manage the inflammation and pain associated with juvenile idiopathic arthritis. Question 267. A child has a puncture wound and suspected osteomyelitis. Which action is done immediately before the antibiotic is started? Option A. The admission orders are written. Option B. A blood culture is drawn. Option C. A CBC with differential is drawn. Option D. The parents arrive. The correct answer is option B. A blood culture is drawn. Cultures must always be obtained before the first dose of antibiotics is administered to ensure accurate identification of the pathogen. Question 268. A 2-year-old child refuses to walk and has a swollen leg. Which does the nurse suspect? Option A, possible fracture of the tibia. Option B, a bruising of the gastrocnemius. Option C, possible fracture of the radius. Option D, no anatomic injury. The correct answer is option A, possible fracture of the tibia. Swelling and refusal to bear weight in a toddler's leg are classic indicators of a toddler's fracture or tibial fracture. Question 269. Which information should the nurse provide to the parents of a child with cerebral palsy? Option A, irregular screening is important for secondary delays. Option B, CP is caused by injury to upper motor neurons. Option C, milestones will require no intervention. Option D, outdoor activities are prohibited. The correct answer is option B. CP is caused by injury to upper motor neurons. Cerebral palsy is a motor dysfunction disorder resulting from permanent, non-progressive damage to the upper motor neurons. Question 270. Which statement about Duchenne's muscular dystrophy is most accurate? Option A, daughters have 50% chance as carriers, sons 50% chance of disease. Option B, both have a 50% chance of developing the disease. Option C, each child has a 25% chance of developing it. Option D, sons only have a 25% chance of developing it. The correct answer is option A. Daughters have 50% chance as carriers, sons 50% chance of disease. Duchenne's is an X-linked recessive disorder. A carrier mother has a 50% chance of passing the affected X to her son's disease or daughter's carrier. Question 271. Mrs. Chua, a 78-year-old client, is admitted with the diagnosis of mild chronic heart failure. Which lung sound does the nurse expect to hear? Option A, a stridor. Option B, crackles. Option C, wheezes. Option D, friction rubs. The correct answer is option B, crackles. Crackles, rales, are the classic breath sound associated with heart failure, caused by fluid in the small airways and alveoli. Question 272. Patrick, hospitalized following a myocardial infarction, asks why he is taking morphine. The nurse explains that morphine, option A, decreases anxiety and restlessness. Option B, prevents shock and relieves pain. Option C, dilates coronary blood vessels. Option D, helps prevent fibrillation. The correct answer is option B, prevents shock and relieves pain. Morphine is the drug of choice in knee because it relieves severe pain, reduces anxiety, decreasing sympathetic workload, and reduces preload/afterload. Question 273. Which of the following should the nurse teach the client about the signs of digitalis toxicity? Option A, increased appetite. Option B, elevated blood pressure. Option C, skin rash over the chest and back. Option D, visual disturbances such as seeing yellow spots. The correct answer is option D, visual disturbances such as seeing yellow spots. Digitalis, digoxin, toxicity commonly presents as gastrointestinal distress and visual changes, particularly yellow-green halos or spots. Question 274. Nurse Tricia teaches a client with heart failure to take oral furosemide in the morning. The reason for this is to help. Option A, retard rapid drug absorption. Option B, excrete excessive fluids accumulated at night. Option C, prevent sleep disturbances during the night. Option D, prevention of electrolyte imbalance. The correct answer is option C, prevent sleep disturbances during the night. Taking diuretics in the morning prevents nocturia, frequent nighttime urination, which would otherwise disturb the client's sleep. Question 275. What would be the primary goal of therapy for a client with pulmonary edema and heart failure? Option A, enhance comfort. Option B, increase cardiac output. Option C, improve respiratory status. Option D, decrease peripheral edema. The correct answer is option B, increase cardiac output. By increasing cardiac output, the heart pumps more effectively, which reduces the backup of fluid into the lungs, pulmonary edema. Question 276. Nurse Linda is monitoring a client with decerebrate posturing. Which of the following is a characteristic of this type of posturing? Option A, upper extremity flexion with lower extremity flexion. Option B, upper extremity flexion with lower extremity extension. Option C, extension of the extremities after a stimulus. Option D, a flexion of the extremities after stimulus. The correct answer is option C, extension of the extremities after a stimulus. Decerebrate posturing involves the rigid extension of all four extremities and is usually a sign of severe brainstem injury. Question 277. Nurse Betty informs a client taking Cascara Sagrada that which of the following may be experienced as a side effect? Option A, GI bleeding. Option B, peptic ulcer disease. Option C, abdominal cramps. Option D, partial bowel obstruction. The correct answer is option C, abdominal cramps. Cascara Sagrada is a stimulant laxative that can cause significant abdominal cramping as it increases peristalsis. Question 278. Dr. Marquez orders a continuous 4-nitroglycerin infusion for a client with me. Which is the most essential nursing action? Option A, monitoring urine output frequently. Option B, monitoring blood pressure every 4 hours. Option C, obtaining serum potassium levels daily. Option D, obtaining an infusion pump for the medication. The correct answer is option D, obtaining an infusion pump for the medication. For nitroglycerin is a potent vasodilator and must be administered via a volumetric infusion pump to ensure precise dosing and prevent hypotension. Question 279. During the second day of hospitalization for me, which of the following is an expected outcome? Option A, be able to perform self-care without pain. Option B, severe chest pain. Option C, can recognize the risk factors of me. Option D, can participate in cardiac rehab walking program. The correct answer is option C, can recognize the risk factors of me. By the second day, the patient should be hemodynamically stable and ready to begin education on lifestyle modifications and risk factor reduction. Question 280. A client is admitted with a right-sided brain attack. In caring for this client, the nurse should plan to: Option A, apply elastic stockings. Option B, use hand roll and extend the left upper extremity on a pillow. Option C, use a bed cradle to prevent dorsiflexion. Option D, do passive range of motion exercise. The correct answer is option B, use hand roll and extend the left upper extremity on a pillow. Supporting the affected left side with hand rolls and pillows helps prevent contractures and maintains functional alignment. Question 281. A client has returned to the unit after a left nephrectomy. Which of the following is the highest priority? Option A, hourly urine output. Option B, temperature. Option C, be able to turn side to side. Option D, able to sip clear liquid. The correct answer is option A, hourly urine output. Monitoring hourly urine output is critical to ensure the remaining kidney is functioning adequately and to detect early signs of shock. Question 282. During precardiac catheterization teaching, Nurse Cherry should inform the client that the primary purpose of the procedure is: Option A, to determine the existence of CHD. Option B, to visualize the disease process in the coronary arteries. Option C, to obtain the heart chamber's pressure. Option D, to measure oxygen content. The correct answer is option B, to visualize the disease process in the coronary arteries. The primary diagnostic goal of cardiac catheterization is to visualize blockages or narrowing in the coronary arteries via angiography. Question 283. During the first several hours after a cardiac catheterization, it is essential for the nurse to: Option A, elevate the client's bed at 45 degrees. Option B, instruct the client to cough and deep breathe. Option C, frequently monitor the client's apical pulse and blood pressure. Option D, monitor temperature every hour. The correct answer is option C, frequently monitor the client's apical pulse and blood pressure. Frequent vital signs and assessment of the insertion site, for bleeding/hematoma, and peripheral pulses are the priorities post-procedure. Question 284. Kate, who had mitral valve replacement, experiences continuous bleeding from the incision. Which agent should the nurse prepare? Option A, protamine sulfate. Option B, quinidine sulfate. Option C, vitamin C. Option D, Coumadin. The correct answer is option A, protamine sulfate. Protamine sulfate is the specific antidote used to reverse the effects of heparin, which is often used during cardiac surgery. Question 285. To promote good dental care in clients with endocarditis, the teaching plan should include the proper use of A. Option A, a dental floss. Option B, electric toothbrush. Option C, manual toothbrush. Option D, irrigation device. The correct answer is option C, manual toothbrush. A soft manual toothbrush is preferred. Devices like water picks or floss can cause gingival trauma and bleeding, leading to bacteremia. Question 286. After a long leg cast is removed, the male client should: Option A. Cleanse the leg by scrubbing with a brisk motion. Option B. Put leg through full range of motion twice daily. Option C. Report any discomfort or stiffness to the physician. Option D. Elevate the leg when sitting for long periods of time. The correct answer is option D. Elevate the leg when sitting for long periods of time. After cast removal, the limb is prone to edema due to the loss of support. Elevation helps manage swelling. Question 287. While performing a physical assessment of a client with gout, the nurse should assess for additional tophi on the option A. buttocks, option B. ears, option C. face, option D. abdomen. The correct answer is option B. Ears. Tophi, urate crystals, commonly deposit in the outer ear, pinna, as well as in the joints of the hands and feet. Question 288. Demonstration of crutch walking with a tripod gait was understood when the client places weight on the option A. palms of the hands and axillary regions. Option B. palms of the hand. Option C. axillary regions. Option D. feet, which are set apart. The correct answer is option B. Palms of the hand. In crutch walking, weight should be supported by the palms of the hands, never the axillae, to prevent brachial plexus nerve damage. Question 289. A client with RA states he only has no pain when lying still. During the convalescent stage, the nurse should encourage option A. active joint flexion and extension. Option B. continued immobility until pain subsides. Option C. range of motion exercises twice daily. Option D. flexion exercises 3 times daily. The correct answer is option C. Range of motion exercises twice daily. ROM exercises are essential to prevent joint ankylosis, permanent stiffening, and maintain as much function as possible. Question 290. Following spinal surgery, the nurse should perform which assessment? Option A. Observe the client's bowel movement and voiding patterns. Option B. Log roll the client to prone position. Option C. Assess the client's feet for sensation and circulation. Option D. Encourage client to drink plenty of fluids. The correct answer is option C. Assess the client's feet for sensation and circulation. Assessing neurovascular status, sensation and circulation in the extremities is vital to ensure no spinal cord or nerve damage occurred. Question 291. During the diuretic phase of acute renal failure, the client must be assessed for signs of option A. hypovolemia. Option B. renal failure. Option C. metabolic acidosis. Option D. hyperkalemia. The correct answer is option A. hypovolemia. In the diuretic phase, the kidneys can produce urine but cannot concentrate it, leading to massive fluid loss and potential hypovolemic shock. Question 292. Which of the following tests differentiates mucus from cerebrospinal fluid, CSF, in nasal drainage? Option A. Protein. Option B. Specific gravity. Option C. Glucose. Option D. Microorganism. The correct answer is option C. Glucose. CSF contains glucose, whereas normal nasal mucus does not. A simple bedside glucose test, dextrostix, can help identify a CSF leak. Question 293. What is the primary cause of tonic-clonic seizures in adults older than 20 years? Option A. Electrolyte imbalance. Option B. Head trauma. Option C. Epilepsy. Option D. A congenital defect. The correct answer is option B. Head trauma. While many factors exist, head trauma is a leading cause of acquired seizure disorders in the adult population. Question 294. What is the priority nursing assessment in the first 24 hours after admission of a client with a thrombotic CVA? Option A. Pupil size and pupillary response. Option B. Cholesterol level. Option C. Echocardiogram. Option D. Bowel sounds. The correct answer is option A. Pupil size and pupillary response. Monitoring pupillary response is a key part of the neurological assessment to detect changes in intracranial pressure or worsening stroke status. Question 295. Which discharge instruction is most appropriate for a client with multiple sclerosis? Option A. Practice using mechanical aids for future disabilities. Option B. Follow health habits to change the disease course. Option C. Keep active, use stress reduction, and avoid fatigue. Option D. Accept a quiet and inactive lifestyle. The correct answer is option C. Keep active, use stress reduction, and avoid fatigue. MS is characterized by exacerbations. Maintaining a balance of activity and rest while avoiding stress/fatigue helps prevent flare-ups. Question 296. What is the early indicator of hypoxia in the unconscious client? Option A, cyanosis. Option B, increased respirations. Option C, hypertension. Option D, or restlessness. The correct answer is option D, restlessness. Restlessness and agitation are the earliest signs of hypoxia as the brain responds to decreasing oxygen levels. Question 297. A client is experiencing spinal shock. The nurse should expect the function of the bladder to be option A, normal. Option B, atonic. Option C, spastic. Option D, uncontrolled. The correct answer is option B, atonic. Spinal shock results in a temporary loss of all reflex activity below the injury, leading to an atonic, flaccid, bladder and urinary retention. Question 298. During which stage is the action of a carcinogen considered irreversible? Option A, progression stage. Option B, initiation stage. Option C, regression stage. Option D, promotion stage. The correct answer is option A, progression stage. The progression stage is characterized by increased growth rate, invasiveness, and metastasis. At this point, the process is irreversible. Question 299. Among the following components of a thorough pain assessment, which is the most significant? Option A, effect. Option B, cause. Option C, causing factors. Option D, intensity. The correct answer is option D, intensity. Pain is subjective. The client's self-report of pain intensity, using a scale, is the most significant component for directing treatment. Question 300. A 65-year-old female is experiencing a flare-up of pruritus. Which action could aggravate the condition? Option A is sleeping in a humidified environment. Option B, daily baths with fragrant soap. Option C, using clothes made from 100% cotton. Option D, increasing fluid intake. The correct answer is option B, daily baths with fragrant soap. Fragrant soaps and frequent hot baths dry the skin and cause irritation, significantly worsening pruritus, itching. Question 301. A client with bacterial pneumonia is admitted to the pediatric unit. What would the nurse expect the admitting assessment to reveal? Option A, high fever. Option B, non-productive cough. Option C, rhinitis. Option D, vomiting and diarrhea. The correct answer is option A, high fever. Bacterial pneumonia in children usually presents with a sudden onset of high fever, along with a productive cough and respiratory distress. Question 302. The nurse is caring for a client admitted with epiglottitis. Because of the possibility of complete obstruction of the airway, which of the following should the nurse have available? Option A, intravenous access supplies. Option B, a tracheostomy set. Option C, intravenous fluid administration pump. Option D, supplemental oxygen. The correct answer is option B, a tracheostomy set. Epiglottitis is a medical emergency. The nurse must have emergency airway equipment, tracheostomy or intubation set, at the bedside in case of sudden closure. Question 303. A 25-year-old client with Graves' disease is admitted to the unit. What would the nurse expect the admitting assessment to reveal? Option A, bradycardia. Option B, decreased appetite. Option C, exophthalmos. Option D, weight gain. The correct answer is option C, exophthalmos. Exophthalmos, bulging of the eyes, is a classic finding in Graves' disease caused by inflammation of the extraocular muscles and fatty tissue behind the eye. Question 304. The nurse is providing dietary instructions to the mother of an 8-year-old child diagnosed with celiac disease. Which food selection indicates understanding of the instructions? Option A, ham sandwich on whole wheat toast. Option B, spaghetti and meatballs. Option C, hamburger with ketchup. Option D, cheese omelet. The correct answer is option D, cheese omelet. Celiac disease requires a gluten-free diet. Eggs and cheese are naturally gluten-free, whereas wheat toast and pasta contain gluten. Question 305. The nurse is caring for an 80-year-old with chronic bronchitis. Upon finding an O2 sat of 76%, which of the following actions should the nurse take first? Option A, notify the physician. Option B, recheck the O2 saturation level in 15 minutes. Option C, apply oxygen by mask. Option D, assess the pulse. The correct answer is option D, assess the pulse. When a monitor shows a critically low value, 76%, the nurse must first assess the patient's physical status, pulse/circulation, to determine if the reading is accurate or if the patient is in distress. Question 306. The doctor performs an amniotomy on a gravida 3 para 0. Which observation would the nurse be expected to make after the amniotomy? Option A, a fetal heart tones 160 bpm. Option B, a moderate amount of straw-colored fluid. Option C, a small amount of greenish fluid. Option D, a small segment of the umbilical cord. The correct answer is option B, a moderate amount of straw-colored fluid. Normal amniotic fluid is clear or straw-colored. Greenish fluid indicates meconium staining, and a cord segment indicates a prolapsed cord, emergency. Question 307. The client is 2 centimeters dilated. Which of the following statements would the nurse expect her to make? Option A, we have a name picked out for the baby. Option B, I need to push when I have a contraction. Option C, I can't concentrate if anyone is touching me. Option D, when can I get my epidural? The correct answer is option A, we have a name picked out for the baby. In the latent/early phase of labor, 0 to 3 centimeters, clients are typically excited, talkative, and oriented toward future plans for the baby. Question 308. The client is having fetal heart rates of 90 to 110 bpm during the contractions. The first action the nurse should take is: Option A, reposition the monitor. Option B, turn the client to her left side. Option C, ask the client to ambulate. Option D, prepare for delivery. The correct answer is option B, turn the client to her left side. Fetal bradycardia during contractions suggests decreased placental perfusion. Turning the client to the left side maximizes blood flow to the uterus. Question 309. In evaluating the effectiveness of 4-Pitocin for a client with secondary dystocia, the nurse should expect: Option A, a painless delivery. Option B, cervical effacement. Option C, infrequent contractions. Option D, progressive cervical dilation. The correct answer is option D, progressive cervical dilation. The therapeutic goal of Pitocin, oxytocin, in labor is to produce effective contractions that lead to progressive cervical dilation. Question 310. A vaginal exam reveals a footling breech presentation. The nurse should take which of the following actions? Option A, anticipate the need for a cesarean section. Option B, apply the fetal heart monitor. Option C, place the client in genopectoral position. Option D, perform an ultrasound exam. The correct answer is option A, anticipate the need for a cesarean section. A footling breech carries a high risk of umbilical cord prolapse during labor, often necessitating a cesarean section for safe delivery. Question 311. A vaginal exam reveals the cervix is 4 cm dilated, membranes intact, and FHR 160 to 170 bpm. What is the rationale for applying an external fetal monitor? Option A, the cervix is closed. Option B, the membranes are still intact. Option C, the fetal heart tones are within normal limits. Option D, the contractions are intense enough for an internal monitor. The correct answer is option B, the membranes are still intact. Internal monitoring, scalp electrode, requires ruptured membranes. Because the membranes are intact, an external monitor is the appropriate choice. Question 312. Which nursing diagnosis would be most appropriate for the prima gravida as she completes the early phase of labor? Option A, impaired gas exchange. Option B, alteration in placental perfusion. Option C, impaired physical mobility. Option D, potential fluid volume deficit. The correct answer is option D, potential fluid volume deficit. Clients in labor are often NPO or have limited intake while expending significant energy, making them at risk for fluid volume deficit/dehydration. Question 313. At 8 cm dilation, the nurse notes late decelerations in a baseline of 165 to 175 bpm. What is the most likely explanation? Option A, the baby is asleep. Option B, the umbilical cord is compressed. Option C, there is a vagal response. Option D, there is uteroplacental insufficiency. The correct answer is option D, there is uteroplacental insufficiency. Late decelerations are a non-reassuring sign caused by uteroplacental insufficiency, meaning the fetus is not receiving enough oxygen during contractions. Question 314. The nurse notes variable decelerations on the fetal monitor strip. The most appropriate initial action would be to Option A. Notify her doctor. Option B. Start in 4. Option C. Reposition the client. Option D. Readjust the monitor. The correct answer is Option C. Reposition the client. Variable decelerations indicate umbilical cord compression. Changing the mother's position is the first step to relieve pressure on the cord. Question 315. Which of the following is a characteristic of a reassuring fetal heart rate pattern? Option A. A fetal heart rate of 170 to 180 bpm. Option B. A baseline variability of 25 to 35 bpm. Option C. Homogeneous periodic changes. Option D. Acceleration of FHR with fetal movements. The correct answer is Option D. Acceleration of FHR with fetal movements. Accelerations of the fetal heart rate in response to fetal movement are a positive, reassuring sign of fetal well-being. Question 316. The rationale for inserting a French catheter every hour for the client with epidural anesthesia is: Option A. The bladder fills more rapidly. Option B. Patient is in a trance-like state. Option C. The sensation of the bladder filling is diminished. Option D. Patient is embarrassed to ask for a bedpan. The correct answer is Option C. The sensation of the bladder filling is diminished. Epidural anesthesia blocks sensory nerves, meaning the client may not feel the urge to void, which can lead to bladder distension and impede labor. Question 317. A client asks about the most likely time for her to conceive. The nurse explains that conception is most likely to occur when: Option A. Estrogen levels are low. Option B. Luteinizing hormone is high. Option C. The endometrial lining is thin. Option D. The progesterone level is low. The correct answer is Option B. Luteinizing hormone is high. A surge in luteinizing hormone, LH, triggers ovulation, which is the most fertile window for conception. Question 318. The nurse is aware that the success of the rhythm method of birth control depends on the: Option A. Age of the client. Option B. Frequency of intercourse. Option C. Regularity of the menses. Option D. Range of the client's temperature. The correct answer is Option C. Regularity of the menses. The rhythm method, fertility awareness, relies on the regularity of the menstrual cycle to predict the window of ovulation. Question 319. Which method of birth control is most suitable for the client with diabetes? Option A. Intrauterine device. Option B. Oral contraceptives. Option C. Diaphragm. Option D. Contraceptive sponge. The correct answer is Option C. Diaphragm. Diaphragms, barriers, are often preferred for diabetics because they do not affect blood glucose, unlike hormones, or increase infection risk, unlike IUDs. Question 320. The doctor suspects that the client has an ectopic pregnancy. Which symptom is consistent with this diagnosis? Option A. Painless vaginal bleeding. Option B. Abdominal cramping. Option C. Throbbing pain in the upper quadrant. Option D. Sudden, stabbing pain in the lower quadrant. The correct answer is Option D. Sudden, stabbing pain in the lower quadrant. An ectopic pregnancy, especially if ruptured, typically presents as a sudden, sharp, stabbing pain in one of the lower abdominal quadrants. Question 321. Which menu selection will best meet the nutritional needs of the pregnant client? Option A. Hamburger patty, green beans, French fries, and iced tea. Option B. Roast beef sandwich, potato chips, baked beans, and cola. Option C. Baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea. Option D. Fish sandwich, gelatin with fruit, and coffee. The correct answer is Option C. Baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea. Selection C provides a balanced mix of lean protein, calcium, yogurt, and vitamins from fruit, which are essential for fetal development. Question 322. The client with hyperemesis gravidarum is at risk for developing: Option A. A respiratory alkalosis without dehydration. Option B. A metabolic acidosis with dehydration. Option C. Respiratory acidosis without dehydration. Option D. Metabolic alkalosis with dehydration. The correct answer is Option D. Metabolic alkalosis with dehydration. Excessive vomiting, hyperemesis, leads to a loss of gastric hydrochloric acid, resulting in metabolic alkalosis and severe fluid volume deficit. Question 323. The most definitive sign of pregnancy is Option A, elevated human chorionic gonadotropin. Option B, the presence of fetal heart tones. Option C, uterine enlargement. Option D, breast enlargement and tenderness. The correct answer is option B, the presence of fetal heart tones. Fetal heart tones, fetal movement felt by a provider, and ultrasound visualization are positive or definitive signs of pregnancy. Question 324. The nurse is caring for a neonate whose mother is diabetic. The nurse will expect the neonate to be Option A, hypoglycemic, small for gestational age. Option B, hyperglycemic, large for gestational age. Option C, hypoglycemic, large for gestational age. Option D, hyperglycemic, small for gestational age. The correct answer is option C, hypoglycemic, large for gestational age. Maternal hyperglycemia leads to fetal hyperinsulinism. After birth, the insulin remains high but the glucose supply is cut, causing hypoglycemia in a large for gestational age, LGA, baby. Question 325. Which instruction should be included in the nurse's teaching regarding oral contraceptives? Option A, weight gain should be reported to the physician. Option B, an alternate method of birth control is needed when taking antibiotics. Option C, take 2 pills per day for 1 week if a dose is missed. Option D, changes in menstrual flow should be reported to the physician. The correct answer is option B, an alternate method of birth control is needed when taking antibiotics. Certain antibiotics can decrease the effectiveness of oral contraceptives by altering gut flora, so backup barrier methods are required. Question 326. Breastfeeding is contraindicated in the postpartum client with Option A, diabetes. Option B, positive HIV. Option C, hypertension. Option D, thyroid disease. The correct answer is option B, positive HIV. In developed countries, HIV is a contraindication to breastfeeding because the virus can be transmitted to the infant through breast milk. Question 327. A client is admitted with vaginal bleeding and very little discomfort. The nurse's first action should be to Option A, assess the fetal heart tones. Option B, a check for cervical dilation. Option C, check for firmness of the uterus. Option D, obtain a detailed history. The correct answer is option A, assess the fetal heart tones. Painless vaginal bleeding suggests placenta previa. The priority is to assess fetal well-being, FHR, before any other interventions. Question 328. The nurse should tell the client that labor has probably begun when Option A, her contractions are 2 minutes apart. Option B, she has back pain and a bloody discharge. Option C, she experiences abdominal pain and frequent urination. Option D, her contractions are 5 minutes apart. The correct answer is option D, her contractions are 5 minutes apart. Regular contractions that occur at consistent intervals, example, every 5 minutes, an increase in intensity are a sign of true labor. Question 329. Which characteristic is associated with babies born to mothers who smoke during pregnancy? Option A, low birth weight. Option B, large for gestational age. Option C, preterm birth, but appropriate size. Option D, a growth retardation in weight and length. The correct answer is option A, low birth weight. Nicotine causes vasoconstriction of the placental vessels, which reduces the supply of oxygen and nutrients, leading to low birth weight. Question 330. The physician has ordered RhoGAM for an A-negative mother with an O-positive baby. RhoGAM should be administered. Option A, within 72 hours of delivery. Option B, within 1 week of delivery. Option C, within 2 weeks of delivery. Option D, within 1 month of delivery. The correct answer is option A, within 72 hours of delivery. To prevent Rh isoimmunization, RhoGAM must be administered within 72 hours of delivery or any potential exposure to Rh-positive blood. Question 331. When giving intravenous, IV, phenytoin, which of the following methods should you use? Option A, use an inline filter. Option B, withhold other anticonvulsants. Option C, mix the drug with saline solution only. Option D, flush the IV catheter with dextrose solution. The correct answer is option C, mix the drug with saline solution only. Phenytoin is highly unstable and will precipitate if mixed with any solution other than 0.9% normal saline. Question 332. After surgical repair of a hip, Which of the following positions is best for the patient's legs and hips? Option A, abduction. Option B, adduction. Option C, prone. Option D, subluxated. The correct answer is option A, abduction. Abduction, moving the legs away from the midline, prevents the femoral head from dislocating from the newly repaired acetabulum. Question 333. Which of the following factors should be the primary focus of nursing management in a patient with acute pancreatitis? Option A, nutrition management. Option B, fluid and electrolyte balance. Option C, management of hypoglycemia. Option D, pain control. The correct answer is option D, pain control. Pain in acute pancreatitis is often excruciating and is a primary focus of management, although fluid resuscitation is also a high priority. Question 334. After a liver biopsy, place the patient in which of the following positions? Option A, left side lying, with the bed flat. Option B, right side lying, with the bed flat. Option C, left side lying, with the bed in semi-Fowler's position. Option D, right side lying, with the bed in semi-Fowler's position. The correct answer is option B, right side lying, with the bed flat. The patient is placed on the right side to allow the weight of the liver to provide pressure on the biopsy site, which helps prevent hemorrhage. Question 335. Which of the following potentially serious complications could occur with therapy for hypothyroidism? Option A, acute hemolytic reaction. Option B, angina or cardiac arrhythmia. Option C, retinopathy. Option D, thrombocytopenia. The correct answer is option B, angina or cardiac arrhythmia. Thyroid hormone replacement increases the metabolic rate and oxygen demand on the heart, which can precipitate angina or arrhythmias in susceptible patients. Question 336. Adequate fluid replacement and vasopressin replacement are objectives of therapy for which of the following disease processes? Option A, diabetes mellitus. Option B, diabetes insipidus. Option C, diabetic ketoacidosis. Option D, a syndrome of inappropriate antidiuretic hormone secretion, SIAD. The correct answer is option B, diabetes insipidus. Diabetes insipidus is caused by a deficiency in ADH, vasopressin. Therapy focuses on replacing fluid in the missing hormone. Question 337. Patients with type 1 diabetes mellitus may require which of the following changes to their daily routine during periods of infection? Option A, no changes. Option B, less insulin. Option C, more insulin. Option D, oral diabetic agents. The correct answer is option C, more insulin. Infection increases the body's metabolic demand and stress levels, typically leading to increased blood glucose and a need for more insulin. Question 338. On a follow-up visit after having a vaginal hysterectomy, a 32-year-old patient has a decreased hematocrit level. Which of the following complications does this suggest? Option A, hematoma. Option B, hypovolemia. Option C, infection. Option D, pulmonary embolus, PE. The correct answer is option A, hematoma. A drop in hematocrit post-surgery often suggests internal bleeding, such as a vaginal or pelvic hematoma. Question 339. A patient has partial thickness burns to both legs and portions of his trunk. Which of the following IV fluids are given first? Option A, albumin. Option B, the D5W. Option C, lactate Ringer's solution. Option D, a 0.9% sodium chloride solution with potassium. The correct answer is option C, lactate Ringer's solution. Lactate Ringer's is the preferred isotonic solution for initial burn resuscitation as it most closely resembles the electrolyte composition of plasma. Question 340. Which of the following techniques is correct for obtaining a wound culture specimen from a surgical site? Option A, thoroughly irrigate the wound before collecting the specimen. Option B, use a sterile swab and wipe the crusty area around the outside of the wound. Option C, gently roll a sterile swab from the center of the wound outward to collect drainage. Option D, use a sterile swab to collect drainage from the dressing. The correct answer is option C, gently roll a sterile swab from the center of the wound outward to collect drainage. Collecting the specimen from the center of the wound using a rolling motion ensures that fresh exudate is captured rather than surface contaminants. Question 341. A nurse is administering 4-furosemide to a patient admitted with congestive heart failure. After the infusion, which of the following symptoms is not expected? Option A, increased urinary output. Option B, decreased edema. Option C, decreased pain. Option D, decreased blood pressure. The correct answer is option C, decreased pain. Furosemide is a diuretic intended to reduce fluid volume. It is not an analgesic and is not expected to directly decrease pain. Question 342. There are a number of risk factors associated with coronary artery disease. Which of the following is a modifiable risk factor? Option A, gender. Option B, age. Option C, obesity. Option D, heredity. The correct answer is option C, obesity. Obesity is a lifestyle factor that can be modified through diet and exercise, unlike age, gender, or heredity. Question 343. Tissue plasminogen activator, TPA, is considered for a patient with myocardial infarction. Which of the following is a contraindication for treatment with TPA? Option A, worsening chest pain. Option B, history of cerebral hemorrhage. Option C, history of prior myocardial infarction. Option D, hypertension. The correct answer is option B, history of cerebral hemorrhage. A history of cerebral hemorrhage is a major contraindication for thrombolytics, TPA, due to the extreme risk of a new intracranial bleed. Question 344. Following myocardial infarction, a hospitalized patient is encouraged to practice frequent leg exercises. Which of the following choices reflects the purpose of exercise for this patient? Option A, increases fitness and prevents future heart attacks. Option B, prevents bedsores. Option C, prevents DVT, deep vein thrombosis. Option D, prevent constipations. The correct answer is option C, prevents DVT, deep vein thrombosis. Immobility post-ME increases the risk of venous stasis. Leg exercises promote venous return and prevent DVT. Question 345. A patient with myocardial infarction progresses to cardiogenic shock. Which of the following symptoms should the nurse expect? Option A, hypertension. Option B, bradycardia. Option C, bounding pulse. Option D, a confusion. The correct answer is option D, confusion. Cardiogenic shock leads to decreased cardiac output and poor brain perfusion, resulting in restlessness, anxiety, or confusion. Question 346. A patient with a history of congestive heart failure arrives at the clinic complaining of dyspnea. Which of the following actions is the first the nurse should perform? Option A, ask the patient to lie down on the exam table. Option B, draw blood for chemistry panel and ABG. Option C, send the patient for a chest X-ray. Option D, check blood pressure. The correct answer is option D, check blood pressure. The first step in assessment for a patient in distress is checking vital signs to determine the severity of the hemodynamic status. Question 347. A clinic patient prescribed nitroglycerin for angina calls complaining of frequent headaches. Which of the following responses is correct? Option A, stop taking the nitroglycerin. Option B, go to the emergency department. Option C, headaches are a frequent side effect because it causes vasodilation. Option D, the headaches are unlikely to be related. The correct answer is option C. Headaches are a frequent side effect because it causes vasodilation. Nitroglycerin causes systemic vasodilation, which frequently results in headaches. This is a common and expected side effect. Question 348. A patient in remission from colon cancer complains of fatigue and difficulty with concentration. Which of the following explanations would account for her symptoms? Option A. The symptoms may be the result of anemia caused by chemotherapy. Option B. The patient may be immunosuppressed. Option C. The patient may be depressed. Option D. The patient may be dehydrated. The correct answer is option A. The symptoms may be the result of anemia caused by chemotherapy. Chemotherapy can cause long-term bone marrow suppression and anemia, which manifests as fatigue and brain fog or difficulty concentrating. Question 349. A clinic patient has a hemoglobin concentration of 10.8 g/dl and reports a strict vegetarian diet. Which nutritional advice is appropriate? Option A. The diet is providing adequate sources of iron. Option B. The patient should add meat to her diet. Option C. The patient should use iron cookware and eat dark green leafy vegetables. Option D. A cup of coffee should be added to every meal. The correct answer is option C. The patient should use iron cookware and eat dark green leafy vegetables. Vegetarians can maintain iron levels by using iron cookware and consuming non-heme iron sources like legumes and leafy greens. Question 350. A patient is receiving packed red blood cells, PRBCs, for severe anemia. Which of the following is the most accurate statement? Option A. A transfusion reaction is most likely after the infusion is completed. Option B. PRBCs are best infused through a 20G4 catheter. Option C. PRBCs should be flushed with a 5% dextrose solution. Option D. A nurse should remain in the room during the first 15 minutes of infusion. The correct answer is option D. A nurse should remain in the room during the first 15 minutes of infusion. Most hemolytic reactions occur within the first 50 ml of the infusion, therefore, close monitoring in the first 15 minutes is vital. Question 351. A patient who has received chemotherapy is given an injection of epoetin. Which of the following should reflect the findings in his CBC several days later? Option A. An increase in neutrophil count. Option B. An increase in hematocrit. Option C. An increase in platelet count. Option D. An increase in serum iron. The correct answer is option B. An increase in hematocrit. Epoetin alpha stimulates the production of red blood cells, which is reflected as an increase in hematocrit and hemoglobin. Question 352. A patient is admitted with suspected polycythemia vera. Which of the following symptoms is consistent with the diagnosis? Option A. Weight loss. Option B. Increased clotting time. Option C. Hypertension. Option D. Headaches. The correct answer is option D. Headaches. In polycythemia vera, the blood becomes hyperviscous, thick, which frequently causes headaches, dizziness, and visual disturbances. Question 353. A nurse is caring for a patient with a platelet count of 20,000/microliter. Which of the following is an important intervention? Option A. Observe for evidence of spontaneous bleeding. Option B. Limit visitors to family only. Option C. Give aspirin in case of headaches. Option D. Impose immune precautions. The correct answer is option A. Observe for evidence of spontaneous bleeding. A platelet count below 20,000 puts the patient at high risk for spontaneous, life-threatening bleeding. Question 354. A nurse assesses a patient who has been taking long-term corticosteroids. Which of the following is a typical side effect? Select all that apply. Option A. Hypertension. Option B. Cushingoid features. Option C. Hyponatremia. Option D. Low serum albumin. The correct answer is option B. Cushingoid features. Long-term corticosteroid use leads to Cushingoid features, such as a moon face, buffalo hump, and central obesity. Question 355. Which of the following is the most important nursing action when caring for a neutropenic patient? Option A. Change the disposable mask immediately after use. Option B. Change gloves immediately after use. Option C. Minimize patient contact. Option D. Minimize conversation with the patient. The correct answer is option B. Change gloves immediately after use. Strict hand hygiene and changing gloves are the most critical actions to prevent the transmission of pathogens to an immunocompromised patient. Question 356. A nurse teaches family members about infectious precautions for a leukemia patient. Which statement indicates the family needs more education? Option A. We will bring in books and magazines. Option B. We will bring in personal care items. Option C. We will bring in fresh flowers to brighten the room. Option D. We will bring in family pictures. The correct answer is option C. We will bring in fresh flowers to brighten the room. Fresh flowers and plants are prohibited for neutropenic patients because they can harbor mold and bacteria, example, Pseudomonas. Question 357. A nurse is caring for a patient with acute lymphoblastic leukemia, ALL. Which of the following is the most likely age range of the patient? Option A. 3 to 10 years. Option B. 25 to 35 years. Option C. 45 to 55 years. Option D. Over 60 years. The correct answer is option A. 3 to 10 years. ALL is the most common type of leukemia in children, with the peak incidence occurring between ages 3 and 10. Question 358. A patient is admitted for diagnosis of suspected Hodgkin's disease. Which of the following symptoms is typical of Hodgkin's disease? Option A. Painful cervical lymph nodes. Option B. Night sweats and fatigue. Option C. Nausea and vomiting. Option D. Weight gain. The correct answer is option B, night sweats and fatigue. Hodgkin's disease often presents with B symptoms, which include drenching night sweats, fever, fatigue, and unexplained weight loss. Question 359. If the diagnosis of Hodgkin's disease were correct, which of the following cells would the pathologist expect to find in a lymph node biopsy? Option A, lymphoblastic cells. Option B, Reed-Sternberg cells. Option C, Gaucher's cells. Option D, Reeder's cells. The correct answer is option B, Reed-Sternberg cells. The presence of Reed-Sternberg cells, large, multinucleated cells, is the definitive diagnostic marker for Hodgkin's disease. Question 360. A patient is about to undergo bone marrow aspiration and biopsy and expresses fear. Which of the following is the most effective nursing response? Option A, warn the patient to stay very still. Option B, encourage the family to stay in the room. Option C, stay with the patient and focus on slow, deep breathing. Option D, delay the procedure. The correct answer is option C, stay with the patient and focus on slow, deep breathing. Staying with the patient and providing distraction or relaxation techniques, like deep breathing, is the most effective way to manage procedural anxiety. Question 361. The nurse is aware that the following terms used to describe reduced cardiac output and perfusion impairment due to ineffective pumping of the heart is: Option A, anaphylactic shock. Option B, cardiogenic shock. Option C, distributive shock. Option D, myocardial infarction, MI. The correct answer is option B, cardiogenic shock. Cardiogenic shock occurs when the heart's ability to pump blood is severely impaired, leading to reduced cardiac output and systemic tissue hypoperfusion. Question 362. A client with hypertension asks the nurse which factors can cause blood pressure to drop to normal levels. Option A, kidneys excretion to sodium only. Option B, kidneys retention of sodium and water. Option C, kidneys excretion of sodium and water. Option D, kidneys retention of sodium and excretion of water. The correct answer is option C, kidneys excretion of sodium and water. The kidneys regulate blood pressure by managing fluid volume. Excreting excess sodium and water reduces blood volume and pressure. Question 363. Nurse Rose is aware that the statement that best explains why furosemide, Lasix, is administered to treat hypertension is: Option A, it dilates peripheral blood vessels. Option B, it decreases sympathetic cardio acceleration. Option C, it inhibits the angiotensin-converting enzymes. Option D, it inhibits the reabsorption of sodium and water in the loop of Henle. The correct answer is option D, it inhibits the reabsorption of sodium and water in the loop of Henle. Furosemide is a loop diuretic that inhibits sodium and water reabsorption in the loop of Henle, leading to diuresis and decreased blood pressure. Question 364. Nurse Nikki knows that laboratory results supports the diagnosis of systemic lupus erythematosus, SLE, is: Option A, elevated serum complement level. Option B, a thrombocytosis, elevated sedimentation rate. Option C, pancytopenia, elevated anti-nuclear antibody, ANA, titer. Option D, leukocytosis, elevated blood urea nitrogen, BUN, and creatinine levels. The correct answer is option C, pancytopenia, elevated anti-nuclear antibody, ANA, titer. SLE is characterized by pancytopenia, low RBC, WBC, and platelets, and high ANA titers, which are hallmark diagnostic markers. Question 365. Arnold, a 19-year-old client with a mild concussion, complains of a severe headache. Which of the following responses by the nurse is appropriate regarding pain relief? Option A, acetaminophen is strong enough. Option B, aspirin is avoided because of the danger of Reye's syndrome. Option C, narcotics are avoided after a head injury because they may hide a worsening condition. Option D, stronger medications may lead to vomiting. The correct answer is option C. Narcotics are avoided after a head injury because they may hide a worsening condition. Narcotics are avoided after head injuries because they can cause sedation and pupillary changes that mask signs of deteriorating neurologic status. Question 366. When evaluating an arterial blood gas from a male client with a subdural hematoma, the nurse notes the PaCO2 is 30 mm Hg. Which response describes the result? Option A, appropriate, lowering carbon dioxide, CO2, reduces intracranial pressure, ICP. Option B, emergent, the client is poorly oxygenated. Option C, normal. Option D is significant, the client has alveolar hypoventilation. The correct answer is option A. Appropriate, lowering carbon dioxide, CO2, reduces intracranial pressure, ICP. Lowering PaCO2, hypocapnia, causes cerebral vasoconstriction, which helps reduce intracranial volume and pressure in patients with head injuries. Question 367. When prioritizing care, which of the following clients should the nurse Olivia assess first? Option A. A 17-year-old client 24 hours post-appendectomy. Option B. A 33-year-old client with a recent diagnosis of Guillain-Barré syndrome. Option C. A 50-year-old client 3 days post-myocardial infarction. Option D. A 50-year-old client with diverticulitis. The correct answer is option B. A 33-year-old client with a recent diagnosis of Guillain-Barré syndrome. Guillain-Barré syndrome can lead to rapid ascending paralysis affecting respiratory muscles. These patients require frequent monitoring for airway stability. Question 368. JP has been diagnosed with gout and wants to know why colchicine is used in the treatment. Which action explains why it's effective? Option A replaces estrogen. Option B decreases infection. Option C decreases inflammation. Option D decreases bone demineralization. The correct answer is option C, decreases inflammation. Colchicine is an anti-inflammatory medication specifically used to reduce the pain and inflammation associated with acute gout attacks. Question 369. Norma asks for information about osteoarthritis. Which of the following statements about osteoarthritis is correct? Option A. Osteoarthritis is rarely debilitating. Option B. Osteoarthritis is a rare form of arthritis. Option C. Osteoarthritis is the most common form of arthritis. Option D. Osteoarthritis only affects people over 60. The correct answer is option C. Osteoarthritis is the most common form of arthritis. Osteoarthritis is the most common form of arthritis worldwide, characterized by the progressive breakdown of joint cartilage. Question 370. Ruby is receiving thyroid replacement therapy and forgets to take her medicine while sick with the flu. This puts the client at risk for which complication? Option A. Hexophthalmos. Option B. Thyroid storm. Option C. Myxedema coma. Option D. Tibial myxedema. The correct answer is option C. Myxedema coma. Myxedema coma is the life-threatening extreme of hypothyroidism, often triggered by stopping replacement therapy or by systemic stressors like infection. Question 371. Nurse Sugar is assessing a client with Cushing's syndrome. Which observation should the nurse report to the physician first? Option A. Pitting edema of the legs. Option B. An irregular apical pulse. Option C. A dry mucous membranes. Option D. A frequent urination. The correct answer is option B. An irregular apical pulse. Cushing's often involves hypokalemia. An irregular pulse could indicate a dangerous cardiac arrhythmia caused by electrolyte imbalances. Question 372. A client with severe head trauma has urine output rise above 200 ml/hour. Which laboratory findings support the suspicion of diabetes insipidus? Option A. Above normal urine and serum osmolality. Option B. Below normal urine and serum osmolality. Option C. Above normal urine osmolality, below normal serum osmolality. Option D. Below normal urine osmolality, above normal serum osmolality. The correct answer is option D. Below normal urine osmolality, above normal serum osmolality. In D, the lack of ADH leads to the excretion of large amounts of dilute urine, low osmolality, and concentrated blood, high serum osmolality. Question 373. Which statement indicates that a client with hyperosmolar hyperglycemic nonketotic syndrome, HHNS, understands her condition? Option A. I can avoid getting sick by not becoming dehydrated and paying attention to urination and thirst. Option B. If I experience trembling, I should drink soda. Option C. I will notify the physician if my blood glucose is constantly elevated. Option D. If I feel hungry, I'll eat a snack high in carbohydrates. The correct answer is option A. I can avoid getting sick by not becoming dehydrated and paying attention to urination and thirst. HHNS is often triggered by dehydration. Patients must understand the importance of hydration and monitoring for polyuria and polydipsia. Question 374. A 66-year-old client complains of sleeping more, anorexia, weakness, irritability, and bone pain. The nurse would suspect which disorder? Option A, diabetes mellitus. Option B, diabetes insipidus. Option C, hypoparathyroidism. Option D, hyperparathyroidism. The correct answer is option D, hyperparathyroidism. Hyperparathyroidism leads to hypercalcemia, which presents with symptoms like anorexia, bone pain, fatigue, and polyuria. Question 375. Nurse Lord is teaching a client recovering from Addisonian crisis about hydrocortisone. Which statement indicates understanding? Option A, I'll take my hydrocortisone in the late afternoon. Option B, I'll take all of my hydrocortisone in the morning. Option C, I'll take 2/3 of the dose when I wake up and 1/3 in the late afternoon. Option D, I'll take the entire dose at bedtime. The correct answer is option C, I'll take 2/3 of the dose when I wake up and 1/3 in the late afternoon. Steroid replacement therapy typically follows the natural circadian rhythm of cortisol secretion, which is highest in the morning. Question 376. Which laboratory test result suggests a client has a corticotropin-secreting pituitary adenoma? Option A, high corticotropin and low cortisol levels. Option B, low corticotropin and high cortisol levels. Option C, high corticotropin and high cortisol levels. Option D, low corticotropin and low cortisol levels. The correct answer is option C, high corticotropin and high cortisol levels. An ACTH-secreting adenoma causes the adrenal glands to overproduce cortisol, resulting in high levels of both ACTH and cortisol. Question 377. A client is scheduled for a transsphenoidal hypophysectomy. Preoperatively, the nurse should assess for potential complications by Option A, testing for ketones in the urine. Option B, testing urine-specific gravity. Option C, checking temperature every 4 hours. Option D, performing capillary glucose testing every 4 hours. The correct answer is option B, testing urine-specific gravity. Pituitary surgery carries a high risk of diabetes insipidus. Monitoring urine-specific gravity is essential to detect fluid balance changes. Question 378. Regular insulin is administered at 2 p.m. for a glucose level of 250 mg/dl. When should the nurse expect the peak effect? Option A, onset at 2 p.m. and peak at 3 p.m. Option B, onset at 2:15 p.m. and peak at 3 p.m. Option C, onset at 2:30 p.m. and peak at 4 p.m. Option D, onset at 4 p.m. and peak at 6 p.m. The correct answer is option C, onset at 2:30 p.m. and peak at 4 p.m. Regular insulin, short-acting, typically has an onset of 30 to 60 minutes and reaches its peak effect between 2 to 4 hours after administration. Question 379. Which test result would confirm the diagnosis of hyperthyroidism? Option A, no increase in TSH during a TSH stimulation test. Option B, a decreased TSH level. Option C, an increase in TSH after 30 minutes. Option D, below normal levels of serum T3 and T4. The correct answer is option B, a decreased TSH level. In primary hyperthyroidism, high levels of circulating T3 and T4 suppress the pituitary gland, resulting in a low TSH level. Question 380. When teaching a client how to rotate insulin injection sites, which instruction is correct? Option A, inject insulin into healthy tissue with large blood vessels. Option B, rotate injection sites within the same anatomic region. Option C, administer insulin into scar tissue or hypertrophy. Option D, administer insulin into sites above muscles you plan to exercise. The correct answer is option B, rotate injection sites within the same anatomic region. Rotating within the same anatomic region, exampled different spots on the abdomen, helps maintain consistent insulin absorption rates. Question 381. Nurse Sarah expects an elevated serum glucose in HHNS. Which other laboratory finding should the nurse anticipate? Option A, elevated serum acetone level. Option B, serum ketone bodies. Option C, serum alkalosis. Option D, below normal serum potassium level. The correct answer is option D, below normal serum potassium level. HHNS involves profound osmotic diuresis leading to total body potassium depletion through urinary loss. Question 382. For a client with Graves' disease, which nursing intervention promotes comfort? Option A, restricting intake of oral fluids. Option B, placing extra blankets on the client's bed. Option C, limiting intake of high carbohydrate foods. Option D. Maintaining room temperature in the low normal range. The correct answer is option D. Maintaining room temperature in the low normal range. Hyperthyroidism causes heat intolerance due to a hypermetabolic state. Keeping the room cool directly promotes patient comfort. Question 383. Patrick is treated in the emergency department for a Culls fracture. What is a Culls fracture? Option A. Fracture of the distal radius. Option B. Fracture of the olecranon. Option C. Fracture of the humerus. Option D. A fracture of the carpal scaphoid. The correct answer is option A. Fracture of the distal radius. A Culls fracture is a common fracture of the distal radius at the wrist, usually caused by falling on an outstretched hand. Question 384. Cleo is diagnosed with osteoporosis. Which electrolytes are involved in the development of this disorder? Option A. Calcium and sodium. Option B. Calcium and phosphorus. Option C. Phosphorus and potassium. Option D. Potassium and sodium. The correct answer is option B. Calcium and phosphorus. Osteoporosis involves the loss of bone density, which is primarily regulated by the balance of calcium and phosphorus. Question 385. A firefighter treated for smoke inhalation develops severe hypoxia 48 hours after the incident. What condition has likely developed? Option A. Adult respiratory distress syndrome, ARDS. Option B. Atelectasis. Option C. Bronchitis. Option D. Pneumonia. The correct answer is option A. Adult respiratory distress syndrome, ARDS. ARDS is a common and severe complication that occurs 24 to 48 hours after a lung insult such as smoke inhalation or trauma. Question 386. A client develops acute shortness of breath and hypoxia following a right femur fracture. What is the most likely cause? Option A. Asthma attack. Option B. Atelectasis. Option C. Bronchitis. Option D. Fat embolism. The correct answer is option D. Fat embolism. Fat embolism syndrome is a critical risk following long bone fractures and typically presents with sudden respiratory distress and hypoxia. Question 387. A client has decreased to absent breath sounds on the right side, from the apex to the base. Which condition explains this? Option A. Acute asthma. Option B. Chronic bronchitis. Option C. Pneumonia. Option D. Spontaneous pneumothorax. The correct answer is option D. Spontaneous pneumothorax. A pneumothorax involves air in the pleural space causing lung collapse, resulting in absent breath sounds on the affected side. Question 388. Following a motor vehicle accident, a driver has difficulty breathing and no breath sounds in the upper lung lobe. What is the likely diagnosis? Option A. Bronchitis. Option B. Pneumonia. Option C. Pneumothorax. Option D. Tuberculosis, TB. The correct answer is option C. Pneumothorax. Trauma from a car accident frequently results in a pneumothorax due to blunt force or rib fractures piercing the lung tissue. Question 389. If a client requires a pneumonectomy, what fills the area of the thoracic cavity? Option A. The space remains filled with air only. Option B. The surgeon fills the space with a gel. Option C. Serous fluids fill the space and consolidate the region. Option D. The tissue from the other lung grows over. The correct answer is option C. Serous fluids fill the space and consolidate the region. After a lung is removed, the empty space fills with serous fluid which eventually consolidates into fibrous tissue. Question 390. Hemoptysis may be present in the client with a pulmonary embolism because of Option A. Alveolar damage in the infarcted area. Option B. Involvement of major blood vessels in the occluded area. Option C. Loss of lung parenchyma. Option D. Loss of lung tissue. The correct answer is option A. Alveolar damage in the infarcted area. In a PE, lung tissue can become infarcted. As alveoli are damaged, blood may leak into the airways and be expectorated, hemoptysis. Question 391. The nurse is managing care for several clients in the outpatient clinic. Among the following clients who called, which one should the nurse prioritize in responding to first? Option A. A client with hepatitis A reporting itching arms and legs. Option B. A client with a leg cast reporting a funny feeling in the leg. Option C. A client with osteomyelitis who is too nauseous to eat. Option D. A client with rheumatoid arthritis having trouble sleeping. The correct answer is option B. A client with a leg cast reporting a funny feeling in the leg. A funny feeling, paresthesia, in a limb with a cast can indicate neurovascular compromise or compartment syndrome, requiring immediate assessment. Question 392. A nurse on the surgical floor is prioritizing care after report. Which of the following patients should the nurse assess first? Option A. A patient with a gunshot wound and 1.5 centimeters of dark drainage. Option B. A mastectomy patient with 23 milliliters of serosanguinous fluid in the JP drain. Option C. A patient with a collapsed lung and no chest tube drainage in 8 hours. Option D. A patient 3 days post-abdominal perineal resection reporting chills. The correct answer is option D. A patient 3 days post-abdominal perineal resection reporting chills. Chills in a postoperative patient can be an early sign of systemic infection or sepsis, requiring immediate intervention. Question 393. A nurse is monitoring a patient who underwent a thyroidectomy 12 hours ago. Which observation should concern the nurse most? Option A. The patient supports their head/neck when turning. Option B. The patient expresses difficulty swallowing liquids. Option C. The patient appears drowsy and has a sore throat. Option D. The patient shows involuntary flexion of the wrist when blood pressure is measured. The correct answer is option D. The patient shows involuntary flexion of the wrist when blood pressure is measured. Involuntary flexion of the wrist, Trousseau's sign, indicates hypocalcemia, a serious complication if the parathyroid glands were damaged or removed. Question 394. A patient is admitted with suspected appendicitis. Which of the following actions should the nurse prioritize for pain relief? Option A. Encourage the patient to change positions frequently. Option B. Apply warmth to the abdomen with a heating pad. Option C. Use comfort measures and pillows to position the patient comfortably. Option D. Administer an antiemetic as prescribed. The correct answer is option C. Use comfort measures and pillows to position the patient comfortably. For appendicitis, heat is contraindicated as it can cause rupture. Comfort positioning, often side lying with knees flexed, is the safest initial intervention. Question 395. A patient is preparing for their first peritoneal dialysis session. Which of the following actions should the nurse prioritize? Option A. Assess for a bruit and a thrill. Option B. Warm the dialysate solution. Option C. Position the client on the left side. Option D. Insert a Foley catheter. The correct answer is option B. Warm the dialysate solution. Warming the dialysate to body temperature prevents abdominal cramping and causes vasodilation, which improves the efficiency of the exchange. Question 396. A patient with right-sided hemiplegia is learning to use a cane. Which behavior indicates that teaching was effective? Option A. Holds cane in right hand, moves cane then right leg then left leg. Option B. Holds cane in right hand, moves cane then left leg then right leg. Option C. Holds cane in left hand, moves cane then right leg then left leg. Option D. Holds cane in left hand, moves cane then left leg then right leg. The correct answer is option C. Holds cane in left hand, moves cane then right leg then left leg. A cane should be held on the strong side, left. The cane and the weak leg, right, should advance together to provide support. Question 397. An 82-year-old with Parkinson's and mild cognitive impairment is admitted. Which action is most appropriate to promote safety and comfort? Option A. Ask the family to provide personal items like photos. Option B. Select a room with a bed by the door to look down the hall. Option C. Suggest the woman eat her meals in the room with her roommate. Option D. Encourage the woman to ambulate in the halls twice a day. The correct answer is option A. Ask the family to provide personal items like photos. Personal items and photos help orient a cognitively impaired patient to their environment, reducing confusion and anxiety. Question 398. A patient with a recent hip replacement is learning to use a walker. Which behavior indicates teaching was effective? Option A. Slowly pushes the walker forward 12 inches then takes small steps. Option B. Lifts the walker, moves it forward 10 inches, then takes small steps. Option C. Supports weight on the walker while advancing it forward. Option D. Slides the walker 18 inches forward then takes small steps. The correct answer is option B. Lifts the walker, moves it forward 10 inches, then takes small steps. Standard walkers, without wheels, should be lifted and moved forward before the patient takes steps to ensure a stable base of support. Question 399. Which of the following reasons is most likely to increase the risk of sensory deprivation in an elderly group? Option A, increased sensitivity to medication side effects. Option B, decreased visual, auditory, and gustatory abilities. Option C, isolation from families and familiar surroundings. Option D, decrease in musculoskeletal function and mobility. The correct answer is option B, decreased visual, auditory, and gustatory abilities. Loss of sensory input through sight, hearing, and taste directly leads to sensory deprivation in the elderly. Question 400. A patient with emphysema presents with increasing restlessness and confusion. What step should the nurse take next? Option A, encourage the client to perform pursed lip breathing. Option B, check the client's temperature. Option C, assess the client's potassium level. Option D, increase the client's oxygen flow rate. The correct answer is option A, encourage the client to perform pursed lip breathing. Restlessness and confusion in COPD suggest CO2 retention or hypoxia. Pursed lip breathing helps the patient exhale trapped air and improve oxygenation. Question 401. A patient who recently underwent a kidney transplant is being monitored. Which assessment would strongly prompt the nurse to suspect organ rejection? Option A, sudden weight loss. Option B, polyuria. Option C, hypertension. Option D, shock. The correct answer is option C, hypertension. Hypertension, along with fever and tenderness over the graft site, is a classic sign of acute kidney transplant rejection. Question 402. What should be the immediate objective of nursing care for a patient with ureteral colic? Option A, decrease pain. Option B, decrease weight. Option C, decrease hematuria. Option D, increase fluid intake. The correct answer is option A, decrease pain. Ureteral colic causes excruciating pain. Managing the patient's pain is the highest priority before addressing other symptoms. Question 403. What is the primary reason for administering Lugol's iodine solution to a patient before a subtotal thyroidectomy? Option A, decrease the total basal metabolic rate. Option B, maintain the function of the parathyroid glands. Option C, block the formation of thyroxine by the thyroid gland. Option D, decrease the size and vascularity of the thyroid gland. The correct answer is option D, decrease the size and vascularity of the thyroid gland. Iodine solutions, Lugol's, are used preoperatively to reduce the vascularity of the thyroid gland, thereby reducing the risk of hemorrhage during surgery. Question 404. Which of the following conditions can also lead to acute hypoglycemia? Option A, liver disease. Option B, hypertension. Option C, type 2 diabetes. Option D, hyperthyroidism. The correct answer is option A, liver disease. The liver stores glycogen. Liver disease can impair the body's ability to release glucose, leading to hypoglycemia. Question 405. Which systemic side effect should the nurse monitor for in a patient receiving chemotherapy for metastatic carcinoma? Option A, ascites. Option B, nystagmus. Option C, leukopenia. Option D, polycythemia. The correct answer is option C, leukopenia. Chemotherapy causes bone marrow suppression, with leukopenia, low white blood cell count, being a common and dangerous systemic side effect. Question 406. What should the nurse suggest to a colostomy patient to help control the passage of gas? Option A, eliminate foods high in cellulose. Option B, decrease fluid intake at mealtimes. Option C, avoid foods that in the past caused flatus. Option D, adhere to a bland diet prior to social events. The correct answer is option C, avoid foods that in the past caused flatus. Gas production is highly individualized. Avoiding specific foods that the patient knows cause gas is the most effective management strategy. Question 407. Which statement by the patient indicates that instructions for colostomy irrigation have been understood? Option A, I should lie on my left side while instilling the solution. Option B, I should keep the irrigating container less than 18 inches above the stoma. Option C, I should instill a minimum of 1,200 milliliters of solution. Option D, I should insert the catheter deeper if cramping occurs. The correct answer is option B, I should keep the irrigating container less than 18 inches above the stoma. The irrigation bag should be hung no higher than 18 inches to prevent the solution from flowing too quickly, which causes cramping. Question 408. Which intervention is part of the prescribed therapy to correct electrolyte imbalance in a patient in the oliguric phase of acute tubular necrosis? Option A, administer K-oxalate. Option B. Restrict foods high in protein. Option C. Increase oral intake of cheese and milk. Option D. Administer large amounts of normal saline via IV. The correct answer is option A. Administer K-exhalate. In the oliguric phase, hyperkalemia is common. K-exhalate, sodium polystyrene sulfonate, is used to remove excess potassium from the body. Question 409. The physician orders 2 liters of 4 fluid to be administered Q12H. The drop factor is 10 GTT/milliliter. The nurse should set the flow to option A 18 GTT/min, option B a 28 GTT/min, option C 32 GTT/min, option D 36 GTT/min. The correct answer is option B, 28 GTT/min. Calculation: 2000 ml 10 GTT / 12 hours 60 minutes equals 20,000/720 equals 27.7, rounding to 28 GTT/min. Question 410. According to the rule of nines, which area has the largest percent of burns in this patient? Option A, face and neck. Option B, right upper arm and penis. Option C, right thigh and penis. Option D, upper trunk. The correct answer is option D, upper trunk. The upper trunk, anterior, represents 9%, or the entire anterior trunk represents 18%, making it larger than the individual arm or head percentages. Question 411. An unconscious patient is brought in after a fall from a 2-story building. Which assessment finding should the nurse be most concerned about? Option A, reactive pupils. Option B, a depressed fontanelle. Option C, a bleeding from ears. Option D, an elevated temperature. The correct answer is option C, bleeding from ears. Bleeding or cerebrospinal fluid leakage from the ears, otorrhea, is a sign of a basilar skull fracture, a critical emergency. Question 412. Which piece of information indicates a knowledge deficit regarding the management of a cardiac pacemaker? Option A, take your pulse rate once a day in the morning. Option B, maintain a safe distance from high-powered electrical devices. Option C, regular follow-up care is important. Option D, you may engage in contact sports. The correct answer is option D, you may engage in contact sports. Patients with pacemakers must avoid contact sports to prevent damage to the device or dislodging the pacemaker leads. Question 413. Which statement reflects the most relevant knowledge about oxygen administration to a patient with COPD? Option A, oxygen at 1-2L/min is given to maintain the hypoxic stimulus. Option B, hypoxia stimulates central chemoreceptors in the medulla. Option C, oxygen is administered best using a non-rebreathing mask. Option D, blood gases are monitored using a pulse oximeter. The correct answer is option A. Oxygen at 1-2L/min is given to maintain the hypoxic stimulus. In some COPD patients, the drive to breathe is triggered by low oxygen levels, hypoxia. Excessive oxygen can suppress this respiratory drive. Question 414. Placing a postpneumonectomy patient in Fowler's position on either his right side or back primarily. Option A, reduces incisional pain. Option B, facilitates ventilation of the left lung. Option C, equalizes pressure in the pleural space. Option D, increases venous return. The correct answer is option B, facilitates ventilation of the left lung. Positioning the patient on the operative side or back allows the remaining lung, in this case, the left, to expand fully and maximize ventilation. Question 415. In teaching a patient what to expect after a bronchoscopy, what is the highest priority information? Option A, food and fluids will be withheld for at least 2 hours. Option B, warm saline gargles will be done every 2 hours. Option C, coughing and deep breathing exercises will be done every 2 hours. Option D, only ice chips and cold liquids will be allowed initially. The correct answer is option A, food and fluids will be withheld for at least 2 hours. Following a bronchoscopy, the gag reflex is suppressed by anesthesia. Food and fluids must be withheld until the reflex returns to prevent aspiration. Question 416. For which condition should the nurse expect hypertonic glucose, insulin infusions, and sodium bicarbonate to be used? Option A, hypernatremia. Option B, hypokalemia. Option C, hyperkalemia. Option D, hypercalcemia. The correct answer is option C, hyperkalemia. Insulin and glucose work together to shift potassium from the extracellular fluid into the cells, rapidly lowering serum potassium levels. Question 417. Which statement by the nurse is most appropriate for a patient diagnosed with condylomata acuminata, genital warts? Option A. This condition increases your risk for cervical cancer. Option B. The usual treatment for this is metronidazole, flagyl. Option C. Using condoms completely eliminates the risk of transmission. Option D. HPV cannot be transmitted during oral sex. The correct answer is option A. This condition increases your risk for cervical cancer. Condylomata acuminata is caused by HPV, which is strongly linked to the development of cervical cancer. Regular pap smears are essential. Question 418. Regarding the anatomy of the kidneys, which of the following is true? Option A. The left kidney usually is slightly higher than the right one. Option B. The kidneys are situated just above the adrenal glands. Option C. The average kidney is 5 cm long and 2 cm wide. Option D. The kidneys lie between the 10th and 12th thoracic vertebrae. The correct answer is option A. The left kidney usually is slightly higher than the right one. The right kidney is usually slightly lower than the left because it is displaced downward by the liver. Question 419. Which laboratory test result is most consistent with a diagnosis of chronic renal failure, CRF? Option A. Increased pH with decreased hydrogen ions. Option B. Increased serum levels of potassium, magnesium, and calcium. Option C. BUN 100 mg/dl and serum creatinine 6.5 mg/dl. Option D. Uric acid analysis 3.5 mg/dl and PSP excretion 75%. The correct answer is option C. BUN 100 mg/dl and serum creatinine 6.5 mg/dl. CRF is characterized by the accumulation of nitrogenous waste, resulting in significantly elevated BUN and creatinine levels. Question 420. The nurse should provide which definition of dysplasia? Option A. A presence of undifferentiated tumor cells. Option B. Increase in the number of normal cells. Option C. Replacement of one cell type by another type. Option D. Alteration in the size, shape, and organization of cells. The correct answer is option D. Alteration in the size, shape, and organization of cells. Dysplasia refers to abnormal development or growth of cells, characterized by changes in size, shape, and appearance, often a precursor to cancer. Question 421. The nurse is caring for a 65-year-old male client with a history of ischemic heart disease who has been admitted to the ICU following a myocardial infarction. The client is currently receiving lidocaine IV to manage his ventricular ectopy. Which of the following factors would be most important for the nurse to consider in relation to the administration of this medication? Option A. Decrease in arterial oxygen saturation, SAW2. Option B. Increase in systemic blood pressure. Option C. Presence of premature ventricular contractions, PVCs. Option D. Observation of a widening QRS complex on the ECG. The correct answer is option D. Observation of a widening QRS complex on the ECG. A widening QRS complex on an ECG can indicate lidocaine toxicity or significant conduction delay, which is a critical safety consideration during administration. Question 422. A 72-year-old male patient with a history of atrial fibrillation and controlled hypertension has been initiated on warfarin therapy. The patient has a recent history of a peptic ulcer. Which instruction should the nurse prioritize when providing discharge teaching? Option A. Report incidents of diarrhea. Option B. Avoid foods high in vitamin K. Option C. Use a straight razor when shaving. Option D. Monitor for signs of bleeding, such as bruising or black tarry stools. The correct answer is option D. Monitor for signs of bleeding, such as bruising or black tarry stools. Warfarin increases the risk of bleeding. Given the history of peptic ulcers, monitoring for GI bleeds, black tarry stools, is the highest priority. Question 423. A nurse is preparing to insert an IV catheter for a 33-year-old patient who has a notably hairy forearm and is allergic to adhesives. How should the nurse manage excess hair at the intended catheter insertion site? Option A. Leaving the hair intact. Option B. Shaving the area. Option C. Clipping the hair in the area. Option D. Removing the hair with a depilatory. The correct answer is option C. Clipping the hair in the area. Clipping hair is preferred over shaving to prevent microabrasions that increase the risk of infection at the insertion site. Question 424. A nurse is educating an elderly female patient diagnosed with osteoporosis who leads a sedentary lifestyle. Which complication should the nurse emphasize as the most significant risk? Option A, increased susceptibility to bone fractures. Option B, consequences of long-term estrogen deficiency. Option C, impact of sustained negative calcium balance. Option D, the progression of spinal deformities. The correct answer is option A, increased susceptibility to bone fractures. The most significant clinical consequence of osteoporosis is the risk of fractures occurring from minimal trauma or daily activities. Question 425. What should the nurse identify as the primary goal for women performing regular breast self-examination, BSE? Option A, to detect any cancerous lumps early. Option B, to identify areas of thickness or fullness. Option C, to notice any changes in the breast tissue from what is normal for each individual. Option D, to differentiate between fibrocystic masses and other lumps. The correct answer is option C, to notice any changes in the breast tissue from what is normal for each individual. The goal of BSE is for the individual to become familiar with their own normal so they can report any changes to a healthcare provider immediately. Question 426. A nurse is managing the care of a client diagnosed with hyperthyroidism reporting palpitations and weight loss. Which nursing intervention should be prioritized? Option A, provide extra blankets to maintain warmth. Option B, a monitor for increased signs of restlessness, sweating, and weight loss. Option C, encourage increased physical activity. Option D, offer a low iodine diet and coordinate with a dietitian. The correct answer is option B, monitor for increased signs of restlessness, sweating, and weight loss. Hyperthyroidism involves hypermetabolism. Monitoring for worsening symptoms like extreme restlessness or weight loss helps identify potential thyroid storm. Question 427. A 55-year-old client has been diagnosed with atherosclerosis. Which of the following lifestyle modifications should the nurse emphasize? Option A, a focus on overall health rather than weight. Option B, incremental increase in low-intensity exercise. Option C, adherence to a heart-healthy diet low in saturated fats and cholesterol. Option D, counseling on stress management techniques. The correct answer is option C, adherence to a heart-healthy diet low in saturated fats and cholesterol. A diet low in saturated fats and cholesterol directly targets the primary cause of plaque buildup in atherosclerosis. Question 428. A client has undergone a laminectomy to relieve spinal cord compression. Which technique should the nurse use to reposition the client safely? Option A, log roll the client carefully to maintain spinal alignment. Option B, assist the client to dangle on the side of the bed. Option C, encourage the client to use an overhead trapeze. Option D, instruct the client to perform gentle range of motion exercises. The correct answer is option A, log roll the client carefully to maintain spinal alignment. Log rolling ensures that the spine stays aligned as a single unit, preventing stress or injury to the surgical site. Question 429. A client who just had cataract removal is being prepared for discharge. Which of the following should be included in the discharge education? Option A, restrict fluids to limit urination. Option B, avoid lifting objects heavier than 5 pounds 2.25 kilograms. Option C, remain in a prone position while resting. Option D, refrain from straining during bowel movements and avoid bending at the waist. The correct answer is option D, refrain from straining during bowel movements and avoid bending at the waist. Straining and bending increase intraocular pressure, which can damage the surgical site or displace the new lens. Question 430. At what age should the nurse emphasize the initiation of regular testicular self-examinations? Option A, at the onset of sexual activity. Option B, after the age of 69. Option C, starting after age 40. Option D, prior to the age of 20. The correct answer is option D, prior to the age of 20. Testicular cancer is the most common cancer in young men, ages 15 to 35, so habits should be established before age 20. Question 431. A client's surgical wound site has suddenly dehisced, and there is evisceration. Which step should the nurse perform first? Option A, promptly notify the surgeon. Option B, to immediately cover the eviscerated tissue with a sterile saline dressing. Option C, check the client's vital signs. Option D, attempt to gently approximate the wound edges. The correct answer is option B, Immediately cover the eviscerated tissue with a sterile saline dressing. Protecting the exposed organs with a sterile, moist dressing is the immediate priority to prevent tissue drying and infection. Question 432. The nurse observes a patient's respiratory cycle increasing and decreasing in depth and rate, with periods of apnea. This observation is most consistent with Option A, progressively deeper breaths followed by shallower breaths with apneic periods. Option B, rapid, deep breathing with abrupt pauses. Option C, rapid, deep breathing without pauses. Option D, shallow breathing with an increased respiratory rate. The correct answer is Option A, progressively deeper breaths followed by shallower breaths with apneic periods. This describes Cheyne-Stokes respirations, often seen in end-of-life care or severe brain injury. Question 433. Which type of breath sounds is the nurse most likely to auscultate that are typically associated with heart failure? Option A, atracheal. Option B, fine crackles. Option C, coarse crackles. Option D, friction rubs. The correct answer is Option B, fine crackles. Fine crackles are the classic auscultatory finding for pulmonary edema associated with left-sided heart failure. Question 434. A patient in an acute asthma exacerbation who was wheezing loudly suddenly has no audible breath sounds. What is the most likely explanation? Option A, the asthma attack has resolved. Option B, the airways are so constricted that air cannot pass through. Option C, the inflammation within the airways has subsided. Option D, fine crackles have replaced the wheezes. The correct answer is Option B, the airways are so constricted that air cannot pass through. A silent chest is a medical emergency indicating that air movement is insufficient to produce sound. Question 435. A patient begins to have a tonic-clonic seizure. During the active phase, which of the following actions should the nurse take? Option A, insert a padded tongue depressor. Option B, prepare to use a bite block. Option C, restrain the limbs gently. Option D, turn the patient to a side-lying position and protect the head. The correct answer is Option D, turn the patient to a side-lying position and protect the head. Turning the patient to the side prevents aspiration, and protecting the head prevents physical trauma during the seizure. Question 436. After chest tube insertion for pneumothorax, a client develops hypotension, neck vein distension, and tracheal shift. What cause should the nurse check for? Option A, infection of the lung. Option B, kinked or obstructed chest tube. Option C, excessive water in the water seal chamber. Option D, excessive chest tube drainage. The correct answer is Option B, kinked or obstructed chest tube. A kinked chest tube prevents air from escaping the pleural space, leading to a buildup of pressure and tension pneumothorax. Question 437. A patient with a history of stroke starts choking on food but is coughing loudly and forcefully. What should the nurse do? Option A, perform the abdominal thrust maneuver immediately. Option B, perform back blows and chest thrusts. Option C, exit the room to summon help. Option D, stay with the patient and encourage him to keep coughing. The correct answer is Option D, stay with the patient and encourage him to keep coughing. If the patient is coughing forcefully, the airway is only partially obstructed. Encouraging coughing is the safest way to clear the object. Question 438. Which information would be most beneficial for the nurse to gather to tailor an individualized care plan for an 84-year-old with hypertension and mild cognitive impairment? Option A, general health overview of the last decade. Option B, current health promotion activities like diet and exercise. Option C, comprehensive family history of chronic diseases. Option D, the patient's marital status and living arrangements. The correct answer is Option B, current health promotion activities like diet and exercise. Knowing current habits allows the nurse to build on existing strengths and address specific deficits in the patient's daily routine. Question 439. To minimize the risk of aspiration during oral care for a comatose patient, what should the nurse do? Option A, apply lemon glycerin swabs. Option B, brush teeth while the patient is flat on her back. Option C, position the patient in a side-lying position and lower the head of the bed. Option D, use hydrogen peroxide to cleanse the mouth. The correct answer is Option C, position the patient in a side-lying position and lower the head of the bed. Side-lying position with the head lowered allows secretions to drain out of the mouth rather than into the trachea. Question 440. A dehydrated client with a change in mental status has a fever of 103 degrees Fahrenheit, yellow sputum, and pleuritic chest pain. The nurse suspects which condition? Option A, adult respiratory distress syndrome, ARDS. Option B, myocardial infarction, MI. Option C, pneumonia. Option D, tuberculosis. The correct answer is option C, pneumonia. Fever, productive cough with yellow sputum, and pleuritic pain are classic indicators of pneumonia. Question 441. In a TB outbreak, which of these clients should the nurse prioritize for TB screening? Option A, 16-year-old with mild cough and fatigue. Option B, 33-year-old daycare worker with travel history. Option C, 43-year-old homeless man with alcohol use disorder, coughing up blood. Option D, a 54-year-old businessman with weight loss. The correct answer is option C, 43-year-old homeless man with alcohol use disorder, coughing up blood. Homelessness, substance use, and hemoptysis, coughing up blood, are high-risk indicators for active TB. Question 442. A patient has a positive MANTA test and night sweats. A chest X-ray is ordered. This diagnostic test is most crucial for which reason? Option A, to confirm the presence of active pulmonary tuberculosis. Option B, to determine if there is a need for a repeat MANTA test. Option C, to assess the size and spread of any lesions within the lung tissue. Option D, to differentiate between primary and latent TB. The correct answer is option C, to assess the size and spread of any lesions within the lung tissue. While sputum culture confirms the diagnosis, the X-ray is crucial to visualize the extent of lung involvement and the presence of cavities. Question 443. A patient presents with an asthma exacerbation and reduced peak flow. Which medication class should the nurse anticipate administering first? Option A, beta-adrenergic blockers. Option B, bronchodilators. Option C, inhaled steroids. Option D, oral steroids. The correct answer is option B, bronchodilators. Short-acting bronchodilators, like albuterol, are the first-line treatment to open the airways during an acute attack. Question 444. A patient presents with a persistent cough with thick sputum, lower extremity swelling, and blue-tinged nail beds with a 40-year smoking history. What is the most likely diagnosis? Option A, adult respiratory distress syndrome, ARDS. Option B, asthma. Option C, chronic obstructive bronchitis. Option D, emphysema. The correct answer is option C, chronic obstructive bronchitis. Chronic bronchitis is characterized by a productive cough, blue bloaters, and peripheral edema due to right-sided heart strain. Question 445. A postoperative embolectomy patient is refusing further surgery despite missing pulses. What is the nurse's initial response? Option A, to explain the risks of not having the surgery. Option B, notify the physician immediately. Option C, notify the nursing supervisor. Option D, record the client's refusal in the notes. The correct answer is option B, notify the physician immediately. The surgeon must be notified immediately of the change in vascular status and the patient's refusal, as this is a limb-threatening emergency. Question 446. During the endorsement, which of the following clients should the on-duty nurse assess first? Option A, 58-year-old with heart failure, BP 126/76. Option B, 89-year-old with end-stage heart failure, DNR. Option C, 62-year-old with thrombophlebitis receiving heparin. Option D, a 75-year-old with new-onset atrial fibrillation receiving diltiazem. The correct answer is option D, 75-year-old with new-onset atrial fibrillation receiving diltiazem. New-onset atrial fibrillation requires immediate assessment of hemodynamic stability and the response to the IV diltiazem. Question 447. A patient taking phenytoin, Dilantin, for seizures presents for a follow-up. What is a common oral assessment finding for this medication? Option A, the gums appear enlarged and inflamed. Option B, the white blood cell count is low. Option C, occasional missed doses. Option D, patient wants to renew driver's license. The correct answer is option A, the gums appear enlarged and inflamed. Gingival hyperplasia, enlarged/inflamed gums, is a well-known side effect of long-term phenytoin use. Question 448. A child with Hirschsprung's disease presents with fever, explosive diarrhea, and abdominal distension. What is the priority action? Option A, monitor the child every 30 minutes. Option B, notify the physician immediately. Option C, administer an antidiarrheal. Option D, administer antipyretics for fever. The correct answer is option B, notify the physician immediately. These are signs of Hirschsprung-associated enterocolitis, HAEC, a life-threatening complication that requires immediate medical intervention. Question 449. Which method is most appropriate for measuring the urine output of a 2-year-old toddler who is not toilet trained? Option A, weighing the diaper. Option B, insert Foley catheter. Option C, ask the mother for number of changes. Option D, compare intake with output. The correct answer is option A, weighing the diaper. Weighing dry versus wet diapers, 1g equals 1 ml, is the standard non-invasive method for accurate output measurement in non-toilet trained children. Question 450. When planning care for an 8-year-old boy with Down syndrome, the nurse should: Option A, plan according to the levels of a 5-year-old. Option B, a plan according to the level of a 7-year-old. Option C, direct all teaching to the parents. Option D, assess the child's current developmental level and plan care accordingly. The correct answer is option D, assess the child's current developmental level and plan care accordingly. Children with Down syndrome have varying degrees of delay. Care must be individualized based on the specific child's current functional and developmental level.